Always some. Okay, so let me do that again. We were called to order at 6:41 PM. And there was a motion, to adopt the agenda by, Monique Hardin Cordero and, seconded by Edwin Torres. Um, now, there will be an exception to the, agenda in that Stephanie Fox had, close to death, in the family is a friend, but very close, we know how that can be. And so she, let us know around 1:33 this evening and this afternoon. So hopefully she'll be at the November 2nd on the climate.
Yeah.
I know some. Okay, hold on, let me get you. There's some background.
I think that is Victor.
And
Can you hear
we
me?
have some background noise. Can someone get the
Yeah,
door?
he's
Oh, there's Monica. Okay, I'm gonna need some help with the door. Okay, perfect. Yes, okay, and can I have a motion to adopt the minutes?
Do we have them?
They were they were emailed. Yeah, they were definitely emailed. They were emailed on, I think, Friday. Or we could, maybe we could just adopt and then she uses the recordings for it.
Okay,
If there's anything that's not correct, can we, a motion to accept it that way because
okay,
we were really late with it today.
all right. So I motion to accept the minutes barring any changes.
Okay, so it's been properly moved and seconded to adopt the minutes, moved by Monique Hardin and seconded by our co-chair Edwin Torres. And just make sure you read the minutes, but one thing about Patricia, and I think we're all so grateful to her. She is just immaculate. The minutes, and so I really appreciate it. I'm not sure if she's on screen or if she's trying to get her. She did send a message. Let me just check that, or we'll just keep moving.
All right.
We'll just keep moving. And so now, I understand we have a very special guest with us. Is he still?
Yeah, so
Yeah,
we have,
our city councilman, Sean Abreu. There he is, and he's in a car.
Hello, hello.
Hi, council member.
Are you kind of, is it a quiet background there?
Yeah, can you hear me okay?
yeah, we
Yeah,
can
I
hear
hear
you.
you fine. Thank you so very much because we extended an invitation to him to be at our meeting. And we're gonna do this, I hope, regularly because you are focusing a lot on health
Yep.
issues, health topics. So there's some feedback.
It's that Victor
Okay.
keeps coming out for me.
Anyway, hopefully, this is just the first of many, okay?
Thank you,
Welcome,
Queen.
Councilman Abreu. So can you give us a little something of what's been happening with you on city council, what you're looking forward to do, and then maybe we can ask a couple of questions?
I sure can. Can you hear me okay still?
Yes, yes.
All right, 1 second. Pulling up my notes. 1 second.
Okay.
You can still hear me, right?
Yes, yes.
All right. So this past election cycle, the council co-sponsored legislation that is now local law that creates the Office of Healthcare Accountability. And this law lists the different medical procedure prices at different hospitals. So a lot of times people go for the same service at a hospital, but they're priced very differently. And now this is going to change that. This will now allow patients to find affordable care and understand potential out-of-pocket costs before receiving care. This law goes into effect in February of 2024. Another issue we're working on is mental health. This past summer, I passed legislation that would create a mental health roadmap portal on the DOHMH website. This was our one-stop shop bill, which would allow you to be directed to services, search for services, and see the location and hours of operation all on one website. And this consolidation of resources for us was important so that we make it easier for people to access services and navigate the city healthcare system. With respect to drugs and substance use, we are seeing a historic level of overdoses. New York City Health Commissioner is now recommending all New Yorkers to carry Narcan, which is crazy to think about, but that's the reality that we're facing. We're seeing fentanyl show up in our daycares. We saw that fatal incident that happened with the young kid, with the young baby out in the Bronx. We're seeing this in our shelters. We're seeing this at the clubs. We're seeing this everywhere. So now the commissioner is encouraging people to carry Narcan with them. With respect to COVID, just so you're aware, the federal government is sending COVID-19 test kits again, and you can visit covid.gov/test to request yours. We're urging everyone to get the booster, their flu vaccine, and the RSV vaccine, as we do expect to see an uptick. With respect to public health, the council passed legislation that is going after unlicensed cannabis sellers. We recently passed a bill that would prohibit landlords from knowingly renting to stores that sell unlicensed cannabis or tobacco products. And the fines are very stiff. For first-time violations is $5,000 and then $10,000 for each subsequent violation. Okay. I can also talk about the budget, but I don't want to take up too much of your time unless you have time for that.
Thank you for the summary.
Yes.
We have the chair, Victor, on the Zoom. Victor, is there something you would like to?
Hello, Chair.
Victor, he's multitasking. He's here and he's also.
There he is.
Hey, good evening, everyone. Good evening, Sean. Good to
Good
see
afternoon,
you.
Chair. Good evening.
Sound like some great updates you gave. I appreciate that. A lot of stuff in our community is reflected and impacted by what you're saying. I have a great team here. I'm very confident. Our health committee is doing an excellent job. We'll be calling on you for things that we might need, and I know you'll be there for us. And we appreciate what you've done so far.
Thank you, Chair. I really appreciate you and your leadership. From what I can see here, the health committees, I mean, you have a doctor on, I'll tell you that. That's a good thing. But you have a great team.
Yes, we definitely do.
Did you see the segment with Victor on CBS in terms of the rat containers? Because I know you were actively involved with that too, Councilman Brer.
Yeah, what's your question on that, Laquita?
Victor, our chair, was on CBS. There was a segment commenting on the pilot project with the rat containers. And I know that project is very important to you too. How do you feel about the startup?
So far, I think we need data to figure out how it's being used. I personally have walked and I have not seen trash outside, which is great. But again, I think there's always room for improvement on everything that gets done. I think a lot of folks are excited. Some folks are also concerned about car usage. I appreciate the concerns there. I think now we need to collect data from DSNY and for them to tell us how much garbage they're collecting and how effective it is. I mean, I hope that we're getting information very soon. That's going to be the next point of contention with DSNY, figuring out how it's working and how we can make things better.
No, we have two questions. Let's see, I think Monique, Edward, and then Monica.
Okay. In regards to cars, we'll come back to that because we have a resolution that we want to show you. And this, I think that you will like what we have proposed here that we're going to pass tonight. But so we can give the audience some time, Monica, and then we have Amir online.
It was Monique,
Oh,
and I can
Monique.
see,
Okay.
But there is a Monica, but Monique has to comment a question.
Okay, so Monique and then Monica and
Monica, and
Amir.
then Amir.
Councilmember Gray, thank you so much for, once again, that update, and I, of course, was particularly interested in what you just stated with passing legislation regarding the illegal cannabis, setups. You said that's gonna be passing when? Now I wanna make sure I heard you correctly.
No, that legislation already passed. And so now it's an enforcement mechanism now where we have to go after landlords that are knowingly giving space to unlicensed cannabis sellers, right?
Right.
And so I think the enforcement arm is going to be key here.
Right.
But $5,000 violation for the first and 10,000 for subsequent violation, I think is a huge deterrent. But again, it comes down to enforcement. Obviously, if you're still continuing to see them in the neighborhood, then the deterrent isn't as effective. But that's where our offices can be helpful and where city agencies can be helpful. And you would have to prove that the landlord knowingly leased its place to an unlicensed cannabis seller.
So, council member, who do I follow up with? Because I just had a meeting, and maybe, of course, I should have you come to our next meeting to share this, but who should we follow up with? Because that enforcement doesn't seem to be having enough teeth.
I would agree with you there because we're still seeing them. Jaleesa from my team is handles everything legislation, and understands how this works, and understands the corresponding agency there. So we can get you data on that. And Jaleesa, her email is jquigley@council.nyc.gov.
All right, council member, thank you. I will follow up with you to extend the invitation, just the same.
Please.
Otherwise, is it set up for 311, a 311 call? Is it set up where someone can call in 311 or?
That's a very good question. I don't know the answer to that, and I'll get it to you.
Okay. Was it
Monica?
Monica, you had a question for the council?
Yes, prior to your endorsement of these wrap containers, did you ask sanitation what was their measurement to determine the success? Because I have no understanding, I can't even imagine how you judge whether or not these containers that are being positioned in our neighborhood have any success.
Well, I think the first measure is not seeing black trash bags on the street. For us, that was a buffet for rats, to really tear into the bags and contribute to the explosive rat population. The other metric is, are people using this? And from what I'm gathering is that they are. When you go into these bins during the day, they're actually sometimes half full, and they get picked 6 days a week. If people are using it, that means that there's less exposure to rats, and is also a more modern waste management practice. But again, I'm sure that DSNY can speak to other metrics that they have that would speak to the effectiveness of this program.
Amir?
Thank you, Edwin. And thank you, council member, for joining us at this committee meeting. It's nice to see you and hear your updates. I just had a question, I guess. You mentioned drug overdoses and that suggestion from the commissioner to carry Narcan. And I was just curious, New York City made history by authorizing supervised injection sites. And it's been proven that these locations have reversed hundreds of drug overdoses. We are saving lives. And I think it's become very clear that more harm reduction oriented policy and kind of public health driven approaches to drug use actually work to save lives, which have a huge impact on our community. So I was just curious if more sites were to be reauthorized, is that something that would have to happen at the city council level? At the city council would have to pass legislation to maybe to authorize additional locations? And if so, I think it would be great if this could be an issue that your office takes on.
So I will say to that the mayor has unilateral control here on the placements of injection sites in the same way they have unilateral control on where to place shelters, right? So it falls within that realm. This has been, proven to be helpful, but I also think it's important that every neighborhood does its fair share. That if we have one in our district or in East Harlem, that we have one in the Upper East Side and then the Upper West Side, right? And I think that we're seeing a lot of saturation that is really irresponsible from city government. And so I think we just need to be more equitable in terms of the placement of these sites. But yes, it's clearly that it works. I think we have to explore. I'm in support of equitable locations. It's just that we always get inundated with them, and no one else sees support for it. And the biggest pushback is people don't want them in their backyards, and that's not right. Right? I support it as a program, but everyone needs to do their fair share. And I'm concerned that we do not have that political will right now at City Hall to do that.
Thank you, council member, for joining us. In regards to parking that we have seen in the community, and with the new bins, we see the benefit that it has for the community, because we are fighting rats. Here we have a resolution that we're gonna look over tonight. And the resolution is to promote residential parking for a comprehensive environmental and health benefit in Community Board 9. I'm not gonna read through everything for you. We can send this to your office for you to review once we pass it here tonight. It still has to go through the executive and then through the general board. But the premise here is to allow the community to have residential parking, a concept that is not foreign to many other communities throughout the country, and if not throughout the world. This will have a positive impact in our environment and also in the health of the resident. Additionally, they can create some de-stress from the parking crisis that we see in the community. Because if you walk around, you will see many vehicles. Plates. I saw the other day a plate from Hawaii. I should have taken a picture because I'm like, how did a car from Hawaii get to New York City? I don't know how I got here, but I saw it. But these are this resolution looks into that. We have another resolution that was passed already, and this is another effort to improve our environment. And this resolution is the commercial vehicle parking and storage overnight in Community Board 9. This was already passed. It was sent to NYPD, DOT. I believe it was sent to your office too. We're having an issue where there is very lax enforcement in laws that already exist within DOT. The laws are very clear that no commercial vehicle shall park in a residential area overnight. And during the day, they should not be parked in excess of 3 hours. From an environmental standpoint, this is creating pollution in our community. We see many vehicles that are camouflage. Some of these school buses that should be at a depot overnight, they are parking in our communities. And you also see trailers parked in our community. We are asking for enforcement because we see the same players night over night parking here. And we are, breathing this nitric oxide to our lungs. Those folks who live here, they are the one dealing with this. And we wrote a very comprehensive resolution that was sent to the NYPD, DOT, and DEP. And we need your help. Tell them the 2-6, tell them the 3-0, tell them traffic enforcement that, CB9 requires the same attention that the Upper East Side get. I'll invite anyone to go to Lexington and Park Avenue and try to find a commercial vehicle overnight. You're gonna see some, but very few. We deserve the same thing. Our lungs are no different than anyone's lungs, and we need enforcement.
I have a question for you. Are there two different resolutions, or is this part of the residential parking
So
permit.
we already passed the reso on the commercial vehicle and parking and storage overnight.
In February.
In February. The other one is a reso, the promotion for residential parking that will be, passing tonight. So these are two
Great.
separate, that's correct. One
That's
was
great.
passed,
Well,
one is on the pipeline.
yeah, I support residential parking permit as a concept. And I look at the result to see it in its entirety. But I support residential parking as a concept. And with respect to the result already passed earlier this year, I mean, I am in full agreement with the board that there needs to be enforcement so that our commercial vehicles aren't taking over residential parking, which, makes it harder for us to find parking. And I have to say, now that I have you, we are working on a bill that would remove abandoned vehicles from the streets within 72 hours upon an agency's knowledge of it. That's one way I'm trying to work to free up parking space in the neighborhood. You have a lot of these booted vehicles that stay there for a long time, and I want to get them out of our streets faster. But also the outdoor dining program, the permanent outdoor dining program now, there are going to be a lot of movable structures now. They're not going to be the permanent sheds that you see, abandoned sheds on the street anymore. They're actually going to be on the sidewalk in most instances, like they used to be on the sidewalk cafes. And so that's also going to help free up parking space as well. So we are looking for ways to free up parking space, but also making sure that we're balanced in everything that we do. And I think that this is a very balanced proposal and something I'm happy to look into more.
Okay, so we'll send it to you. We are for the parking, but we're looking at more from the lens of the environmental impact and health impact that these vehicles have. These trucks, everybody was upset about the depot that we were gonna have, down on
I want
120.
to. Yeah.
We have an unofficial depot in our community. We go at night, you have many, commercial trucks parked overnight, and that's what we're asking for. For the existing rule that DOT has to enforce when it comes to commercial vehicle overnight. But we'll send it to you so we can, get your help in getting some enforcement here.
And I definitely share. I of course share, chief, among those reasons, the environmental concern. I share that concern.
And Edwin brought it to our attention too, that the New York City Council plans to fight loud streets with noise cameras. We had a resolution dealing, do we have a resolution?
Yeah, we passed the res-
Yeah, we passed the resolution related to noise too. So you see, we've been active, Councilman Brea.
I see that.
So, anyway, but it says New York City Council plans to fight loud streets with noise cameras. So we're in support of that and, encourage your efforts. And I'm glad that New York City Council has picked up on that, since noise is one of, I think it's the top complaint we always hear.
Yeah, and we hope that CB9 can benefit from that, and equitable enforcement can take place. Because, when you look at the data, 311 complaints for CB9, noise is always number one. So we are in full support, and we look forward to supporting you with that bill that's coming through.
So Carlina Rivera, the councilwoman, and Councilwoman Gail Brewer, they have bills that would also regulate the noise level, the decibel levels of emergency vehicles too, which, there's a lot that can be done with just lighting, for instance, as opposed to sound. And so we're looking at legislation to help tackle noise concerns and that from that angle as well. And I'm on both of their legislation. And we're happy to send that along, as maybe resolution of support there could also go a long way.
Okay.
And I think you have them already.
Yeah,
So
we'll send them.
if you need us to send them again, we can do that, but you have,
Okay.
Our resolutions already.
Okay, Laquita, I may have to jump off now.
Can you take one more question
Yes,
from
one
our
more.
city member Heather Jason?
Yeah, just quickly, what if anything is being done to stop the illegal use of placards in the window dashboards from some of our uniformed officers that are using placards to park on our streets during street sweeping, advertised street sweeping times, and in front of our fire hydrants for extended periods of time? There just seems to be no enforcement as far as the use of placards are concerned.
Yeah, that's a huge frustration. There's
If they do get a ticket, it's my understanding the tickets just get thrown out. Everybody needs to be treated the same. No one is above the law. And I like to have, my street cleaned regularly without having to deal with a placard in the dashboard that prevents my street from getting swept.
Yeah, that's a big concern that the council really cares about. You have a lot of these cars. Formerly, they would double park so that you can have the streets getting cleaned, but we haven't quite gotten there yet. If there are any legislative ideas we can pursue there, whether it's penalizing cars who prevent streets from getting cleaned, I mean that's something we could explore. But if there's any use of if there's any placard abuse, obviously that's something that the city should also rein in on as well. But it all comes down to enforcement, and we're seeing enforcement issues. It's pervasive. We're not seeing it in city government. We're not seeing it with the e-bikes who are running on opposite sides of the street. I know we're getting a lot of complaints about that in Harlem and also on the Upper West Side. We're seeing it everywhere throughout government right now, is that enforcement is struggling right now. And a lot of that has to do with a staffing crisis, but that's no excuse for the city not to do its job, right? And but I hear you loud and clear.
Thank you.
Thank you
Thank you for
so
joining us.
very much for joining us, and we'll be in touch.
Thank you to
And
all of you, and thank you, Chair.
Thank you.
Bye-bye.
oh, I should ask one other, so the question I was gonna ask has to do with 1727, but I'll see where we are with that inside. Okay, I don't know if there are any other questions that you wanted to present to the council members, so just email, we can probably put them together between now and November 2nd, but hopefully he can have a representative at each of our committee members meetings, to tell you the truth. But between now and then, if there's a question, just email it to me and I'll make sure, that Edward and I both send the question to his representative. I think the newest representative, the district director, is Gabriella Carina, Carena. Gabriella with one L, Gabriela. She called today.
Who was she? I'm sorry.
Her title with Councilman Abreu's office is district director. So she should be our point person on a lot of the issues, that she'll get to him. Okay, and yeah, she works, well, district director, I would think she's in his district office, but I also would think that she is in touch with City Hall as well. That's what I would think. There's a gentleman that comes to our general board meetings, but I can't recall his name.
Sorry, what was her name? Gabriella?
Gabriella with one L. She called twice to make sure she was one who got him here.
And the last name?
Carena, Carena. Okay. So moving forward, is someone here from New York City Department of Health and Mental Health, DOHMA? Is there anyone here? What about on, tell Edwin? Once again, I was hoping that, one of them would be available. Our point person is supposed to be Carmita Padilla, Padilla. However, in the interim, we've been getting information from other sources. I wanna, in this meeting, publicly thank Cheyenne Murillo, who supplied, face mask, hand sanitizer, and something, the face mask, yes, for our MCB9 office. I contacted her when Victor asked, and right away she had it already, and Hakil picked it up that Monday. And I think that September 12th. So since September 12th, it's been, so she has, her role is a little different, announcing, outreach efforts and all. But I'm just, disappointed to say the least that, you know, they haven't really kept up with us. When we requested a meeting, because they're our direct liaison to the city. There are COVID vaccines, available. I believe one of the offices announced, and I think it was announced at our general board meeting, Harlem Action Center, I think that's it. Does that sound familiar?
What, East Harlem? East Harlem
Well,
Action
it should be in
Center?
Central Harlem, but I'm not sure. But the Harlem Action Center, there was a distribution with that information at our general board. And I ran out without our general board information. But there is at least that location provided by the city. CVS has vaccines. The one on 125th Street has Moderna. So if you started taking Moderna or wanted to switch, that's where you can go for the latest COVID vaccine. I opted not because I have all my other vaccines, but I want the Pfizer one because I started with Pfizer and I just figure for me, and for a lot of people, they want to stick with the same provider, you know, and whatever the chemical combination is for that. I know Weill Cornell is also giving vaccines, and I had set it up really to email. I found it today among my emails, so I can email it to you all. If there's any other information you know in terms of where we can get vaccines, but check the various CVS's and Rite Aids as well. Rite Aid did not have theirs last week when I went to the one on Frederick Douglass and 118th Street. They didn't have it yet. So distribution is a thing now. It's available, but it just depends on which pharmacies you go to or other public location. Clotilde?
Yes, so you said, thank you, you said so we did receive, masks. And
Yes.
they are in the office, so how do our constituents know that they can come and?
When they come in, oh, I'm sure, you know what, that's a good question, because the other thing is, we have a website, MCB9.org, and we also have an email address, info@cb9.org. And our meetings are often or can be on YouTube, youtube.com, and you search for MCB9. So we should announce that we have some. I'm not sure how many other agencies, Jonna, do you know anything in terms of, have you all been able to get masks and all? I can tell you Cheyenne Murillo, I can give you her contact information, with DOH, if you are aware of that. But, they were announcing places where they were hosting, forums or participating in other church forums, and they did have masks and all. And there, I heard an announcement, I believe it was yesterday, if not, you know, I listen to, you know, so much news and information. But, that again, once again, they're gonna be making those available because of the surge of COVID, RSV, and the flu, very bad cases. I've had all of those vaccines except for the recent COVID. But I encourage you to get the vaccine, and more people are. But again, for us to effectively announce that, we also need to be able to provide them with location. So hopefully, it may already be on CB9, but I got the information in terms of our sources of announcement. So that was a great question, Clotilde, for others who may wanna come in and pick up COVID or protective supplies.
A firm sign that has, shots too.
Now, they have
Walk
which one,
in.
do you know which one?
It's the street on, it's on 100th Street.
On the east side? So, yeah, that would be 100th and Madison, I would think.
Between Madison and.
And Fifth?
Yeah.
Okay, so
But you
100,
can walk into that. You just
okay,
walk in.
okay. So it sounds like most of the hospitals, I haven't heard in reference to Columbia Presbyterian, even though we have a relationship with them, I haven't heard. Right now, we've heard two, Weill Cornell, and I'll try to, while someone else is speaking, I'll look up their information and come back to it. And
I mean,
then,
they have that little clinic right there. Do they give shots?
I don't, I haven't heard, that's what I said, I haven't heard, so
Yeah.
we'll find out, because we're doing our public health forum
Right.
with them. If anyone else has information to share on that. Okay.
Public library in Grandchester. I know I used to get some of the testing from there. Did you?
Yes, speak up for the mic.
Okay, I say at the library on 145th Street, they used to have the COVID testing.
They have free tests.
Yes.
You can go right into the library and ask them, they'll give it to you.
And you know what, I did not make the Emma Bowen workshop only because of some other, sessions I had earlier. But they may, I have to check with Heritage. Dr. Milano, do you know if Heritage has begun, COVID vaccines?
We are waiting for our delivery. I put something in the chat, Vaccine Finder. And if you look at the map on Vaccine Finder, CVS, Walgreens, Rite Aid, they all have the vaccine. It's been quite a journey to order the COVID vaccine.
Mm-hmm.
And one of the reasons is that we have the vaccine for children program, vaccine for adult program, and then we have and then we have to purchase the new COVID-19. We're only buying Moderna. I made that decision because the vaccines are so expensive, thousands of dollars that we have to put up front to buy the vaccine. And there were many roadblocks. So we ended up ordering through Henry Schein, which is more expensive, because otherwise we would have had to create accounts with Moderna and Pfizer. So it was really a big rigmarole. So we just bought it from Henry Schein, a little bit more expensive, but at least we're hoping that it arrives tomorrow, and the vaccine for children should be coming any day now. But really, I was shocked. This was just like, so it seems the federal government had this sort of contract with all these big chains. I'm happy that they got the vaccine out to all of those pharmacies, but we've been doing vaccines for a long time, and they kind of forgot about us. But that's okay. That's okay. But yes, any day now. We're waiting.
Right.
Thank you.
It's just an issue of distribution, and I guess whatever the mechanism, as Dr. Milano says with that. When you mention children, one of the, here's what, the Weill Cornell, according to the new guidance from the Centers for Disease Control and Prevention, the following groups should receive the latest doses to stay up to date. Everyone aged 5 and up should get 1 dose of the updated Pfizer, BioNTech, or Moderna COVID-19 vaccine. The next, moderately or severely immunocompromised patients may get additional doses of the updated COVID-19 vaccine. Please discuss your need for additional updated doses with your healthcare provider. Children between 6 months to 4 years old, depending on their vaccination status, will need multiple doses of the COVID-19 vaccine, including at least 1 dose of the updated vaccine this fall. Please refer to the CDC for specific guidance by vaccine brand. Patients will be considered up to date with their vaccinations upon completion of recommended updated doses. COVID-19 vaccine recommendations will be issued by the CDC as needed. So that's the latest from the CDC.
Yeah, and it's important to just follow up with your provider, speak to your pharmacist, and they'll give you the individualized advice that you need based on your specific needs. So the moral of the story is follow up, get vaccinated. We have 3 viruses, and based on your specific needs, follow up with your PCP. Okay, so moving on.
Okay, so our next item on the agenda, the latest update on environmental matters via workshops and conferences. I know Heather, I didn't have you down, Heather, because I wasn't sure if you were able to sit in with any of Odette's, 5-year, any other technologies.
Not the most recent ones, but
Yes.
I did receive an email for a makeup session for this Thursday. So I may try to sit in on the makeup session for Thursday.
Okay, I usually get hers, but do you mind forwarding that to
I'll
me
forward it
just
to you.
in case we had problems? And then I know Amir had some interest in technology also, and so maybe he'll be able to make that one too. But I thank you so much, Heather, for your involvement and attendance. Clotilde has some information on an international scope that brings us even locally, international, national, local. So if you could briefly say something. Dr. Clotilde Manguia is, is a new member to our committee, and we welcome her along with Amir Sadeghi to our committee. And if you remember, Amir is a new parent to a newborn, so he is excused and to be part of the remote segment for several months with this newborn. Okay, so Clotilde and Amir, if you could just give us something briefly on, because the environmental matters are key to our committee too, so just briefly what you have and just speak on that.
Thank you for giving me the floor. I'm gonna be a bit brief. I just want to say that on the margin of the United Nations General Assembly that took place last week, there was several events in the city of New York, so that we call the Climate Week New York City. It took on the world stage. That took place between September 17 to the 24th. And that was done in partnership with the United Nations General Assembly, a lot of the UN agency, as well as the city of New York. And about more than 500 activities throughout the city, some online, some hybrid. During the same week, the United Nations Secretary General Antonio Guterres convened what they call the Climate Ambition Summit, where at the headquarters, he urged the head of states, civil society, government, businesses, city, region, financial institutions to really step into and take significant action. One of the goals is to reach what we call the zero greenhouse emission. But when we look at New York, for the city of New York, really what we are trying to do, our goal is to reduce the greenhouse gas emission 80% by the year 2050. So all those meetings were about advocacy, policy, networking, but I attended some of the meetings, but being at the district line, we had to really also be significant and think how our district can be involved. And we've been doing already a lot of things, but I also realized that those activities that we are doing in our district are done in silos. And it's really very important that we recognize and acknowledge even the small activities that we are doing here. So it's gonna be good, to aggregate all our effort, what we are doing, what the school are doing, what can be achieved at our level, how to disseminate the information instead of just having the meeting, advocacy, those meetings and not doing anything. And we know we need to do something. I don't remind you what happened last Friday. This summer has been very horrendous. We know about the pollution. We know that something can happen in a different part of the country and it affects us. Climate change is real. Climate change has impact, tremendous impact on our health. I'm not gonna tell you in detail what are the, but we know that particularly our population, everything is related about asthma, relating about allergy. We've seen a great increase about those diseases and all are linked with climate change. So there's a lot of things that need to be done, but we also have to start with educating our population and also to have them engage in everything that we are doing. So we have a lot of things that we can do together, and we started already about different campaigns being done in the school, the waste management, very important as well. We can increase our energy efficiency. There's so much activities, but it's very important that instead of working really in silo, is to aggregate our effort and see what we are doing here in District 9. So
Thank you very much, Dr. Clotel. That is so true, and we have community partners that we bring, we invite to our meetings, and generally, they remain with us and keep us informed of what they're doing. We hope to, expand on the education component a lot more with the help of community partners. But two ways that we're doing that, through our public health forum that we're looking for a location for, that's our biggest holdup now. But also through our kiosk campaign that Anita Chang is sort of spearheading for us, where we have 84 kiosks in the community, and you're on this committee too, Dr. Clotel, and so is Monique. There are 84 kiosks in the community where we hope to have some message. And these messages can rotate from different community partners, different kiosks, all across the district. Part of the information could be educating them on climate change, on COVID, on maternal health, on teen stress. So we're already examining those, and we have a template, and we're talking to community partners already about participating, where their name, the organization's name gets out there, and they maybe highlight a particular healthcare service that they want the community to know about. And the kiosk can work with audio, and I didn't realize that so much until recently, but there's an audio component, and then of course the visual with the picture. So that's exciting.
I wanted to add, really, we really can use leverage on the technology that we have, all the youth, everybody has one cell phone. And if we have to create content in the various languages which has been spoken in our district, will be also very helpful.
We also need enforcement.
Yeah.
Because you can pass as many laws, as many bills, but if there's no enforcement, or some communities get more enforcement than others, then they're meaningless. We have seen it here firsthand. The need for our agencies to understand that well, climate change, you might not see it because our human eyes eyes are limited as to what we can see. But if you use certain technology, we will be able to see all the CO2 that is out there. We don't have to wait for the storm to let us know that things are happening beyond what we can see. So, I think that that's the concept that we have to, push beyond this room. Have those other agencies that go to perhaps traditionally different, committees, that they come to this, so they can inform themselves to learn about what's happening broader. Because we shouldn't wait until the bus hits us, we see that it's coming.
Yeah.
So yeah, but that's the topic.
And one of the things when you were speaking, Dr. Clotilde, and just now with Edwin, is that with, climate change, it's making mosquitoes migrate in a different way. And we have, some incidents of malaria coming into the United States, already in Florida, and you see how the weather has been there, climate. And I think in Queens, New York now.
Well, there's a dengue, outbreak in New York City. I sent that, I posted that. Dengue.
A dengue virus.
Dengue.
Dengue.
Oh,
There's
really?
an outbreak in New York City and no one's talking about it.
But I didn't, if you sent it, I may not have seen it.
Yeah, I posted it, a few days ago. There was an article about it, but, we need to ask, where is it? I mean, is it in West Harlem? Because if it's in West Harlem, they need to do major outreach. We've never had it before.
It's even more alarming because the primary health care, that's not the first diagnosis
Yeah,
they will look at. And that takes time, but the virus for him to, to appear in your body and to have an impact, that goes very fast.
Well,
It's just like for malaria.
Right.
They're not used to that.
Right.
But they're looking at that now. I mean, apparently the doctors have realized that we have these issues going on. There may be a Legionnaire's outbreak in the Bronx again. So the health department needs to advise us, and we need to know if there was an overflow at that plant because of all the rain. That's one of the effects. Our sewer system is not prepared. And the administration said they're not gonna spend the money to get us prepared, but that flood that we saw on Friday was, it was clear that we're not ready for it.
Absolutely.
Yeah.
So we have one, participant online, Christine.
Yes. Hi, how are you? Yeah, Christine Marisi from Biobus here. I hope you can hear me loud and clear. I know it can be very challenging over Zoom. And thank you so much, Laquita. I'm one of the community partners that just is very excited about this, kiosk idea. We're getting our message together at the moment. And I also want to thank, uplifting our community voices, in terms of concerns in terms of climate justice and environmental change. I have, as some of you might remember, I have been coming into this wonderful community meeting a couple of months ago asking, is there anybody here that wants to speak to our youth, actually doing a summer of community science, citizen science. And I just wanted to invite you. We actually have a public event coming up next Thursday, where the youth that actually did research the whole summer about topics that actually they crafted the research question after having a conversation with members, like We Act, for example, or we had walking tours around the area. So thanks so much for connecting. And they researched noise pollution, bioremediation, air quality disparity, and health consequences in littering. So if you're around, I put information in the chat, and I was gonna send it to you, Laquita, but it's so relevant for at least the youth I'm working with, like high school and college students. And I want to thank you for uplifting this.
Can we, Clotilde, Dr. Mongolia is interested, so can you guys, can you drop something in the chat for the exchange?
Yeah.
Is there anyone else right now in terms of, say, climate and what we're talking about with infectious diseases? Dr. Ronstrom, would you be?
This Thursday.
Is this Thursday?
Yeah.
Okay, so, Amir, if you could hold for a second, Dr. Ronstrom, with the CODA Alliance is also someone we're seeking to have as community partner. And maybe you tie all this together with, your Women's Health Forum, talking to us about what you're doing.
Yeah.
And then Amir will come back, to you on the, environmental as well. But we don't want to have you waiting so, too long, but I knew.
I'm here,
I knew you wanted to listen in and I want you to continue to be a part of our, maybe on the public side of our committee. Okay, I was just gonna see, if you have a minute, we can wrap up under the environmental matters. Amir, I know you don't have a report as such, but I know you expressed interest in environmental, so just to have people hear your interest and, just very briefly, what you think you might pursue for the committee.
Great. Well, thank you, Laquita. I just want to echo everything that's been lifted up in this discussion. As I mentioned, in a questionnaire to the committee, as a new committee member, I'm very excited to be here. I should be in person at the next meeting. Laquita's right. I have a baby just shy of 2 months old. So, still in the midst of a bit of chaos, but I think by next month, should be there in person. But, largely in agreement and with everything that's been spoken, and as I mentioned in that questionnaire to the committee, I have an interest in the kind of social and political intersections with climate justice, especially how climate justice intersects with racial justice. I mean, I think so many folks on this committee already know, but many of the communities in New York who pay the price for our lack of enthusiasm and commitment to build a better climate and just future are Black and brown poor communities in New York City. And we know that actually the recent downpour that was just mentioned a moment ago really profoundly affected people. It's true, our district is not in the floodplain. We're at a pretty, relatively higher elevation compared to Central and South Brooklyn, but it's communities living there who really pay the unique price. So I'm interested in unpacking that, and and I think something that I'd like to uplift in this conversation is that I think there needs to be maybe a focus that I would love to provide in the purview of this discussion is there has to be greater literacy and attention on how the greatest producers of pollution are not individuals but corporations and our military and the industrialized food agribusiness and and airlines. It's massive corporations who are really unleashing havoc on our environment and really destabilizing our communities through their emissions and waste. And I think something that I would like to uplift is that we need to be more comfortable actually wrestling with the nature of capitalism and racial capitalism as the greatest, as the root cause to climate disaster, and especially as it affects New Yorkers in our district. So that's something that I hope to maybe lift up in this committee, and then maybe given the more direct responsibilities and charge of us as community board members who are representing Manhattan Community Board 9. Something that I've been thinking about is the air quality in Manhattanville being significantly worse than other areas of New York City because of the high concentration of industrial and commercial buildings. But that also coincidentally, is where Columbia is expanding its campus. And you know, I'm excited that Columbia has commitments to offset its emissions by purchasing renewable energy certificates from wind farms and other places in the country, but their buildings and their infrastructure, including the trucks importing goods and supplies for students and faculty, create emissions that people in our community inhale and have to live with. And I'm wondering if it might be time to, and forgive me because I'm new, I don't know if this is already something that has been discussed, but if it might be time to have a conversation about a community benefits agreement between Columbia University and the people of the Manhattanville neighborhood. But not just a community benefits agreement about the emissions that are unleashed for our neighbors in Manhattanville, but something with real binding commitments, which I think, you know, I know WEACT, I really defer to their expertise. Obviously, I'm new in a lot of these areas, but so I defer to WEACT, and I know in their 2023 policy agenda, they mention that they're working on trying to figure out how to make community benefits agreements more binding so we can actually hold powerful interests like Columbia University to account. So those are just a few of the ideas I had, but really enjoyed this discussion. And Laquita, I'll pass it back to you.
Okay, two things, Amir. You probably should attend the strategic planning committee, and maybe you can be our representative, actually, because we, because of the community benefits agreement, that really came because of the activism of the Manhattan Community Board 9. That's how we have the West Harlem Development Corporation. There's a whole story, a big story behind that. And it has evolved to this. Now, and I believe that there is certainly an environmental aspect of the community benefits agreement that may touch a bit on what you've brought up. And there's a role for us, especially since one of our public health forums is going to deal with environmental issues. So if you can, let's talk about that. If you can give us a call, and we'll make sure you first look at the community benefits agreement on our website. And under health and environment, there is an environmental component. So you're right on the mark there. The second thing is, based on what you said, I wonder if you also would be available for Christine, you know, on that side environment. I'm not sure if that would work or not, but you can just exchange information in the chat and just see if that works. And Dr. Milano came back. Would you be, Christine was looking for, what was the information again that you wanted to focus on? Climate change and climate issues, Christine?
Yeah, usually, and it's just like, you know, this is like, I want to, again, one part of research is like, you know, once you actually have data available, you want to bring it back to the community. So this is my invitation, like, you know, you should also come to the event. So the students have the chance to just like, you know, loop back like information, whatever they gathered. It's a free after school science hour, but I'm interested in any kind of like, you know, even as simple or as complicated as like, you know, joint curriculum development. Again, we go into schools and teach after school, or like have internships. So any type of resources you have for us, we can just like, you know, incorporate in our like, you know, teaching, so make it meaningful, place-based, connected to the community. Again, we recruit students that live here in the area, but there's just like also like it would be wonderful to actually have like, you know, partners that help us like build up curricula. So if you want to get in touch, Christine@bibus.org or Laquita, you know, I will be around, and hopefully next time in person. Sorry, I didn't realize. I hope I'm also excused.
I think Dr. Milano, you may have Dr. Milano's information from our public health forum meetings, but if Dr. Milano could drop her information in the chat again. Dr. Milano runs the Heritage Healthcare Center, and I'm sure that would be of interest. So you have 2 or 3 people here as resources right now. So, you know, so we've come through in that way for you, okay? All right, so just check the chat for the information. Thank you, Amir. And anything else, Edwin, before going on to Dr. Reinstrom?
No,
Okay,
Just quick, what about
Oh,
one-
Heather?
If we can request from Humberto Garza, our DEP representative, to attend one of our upcoming meetings regarding the air quality in the community as
Yeah.
well as
which one,
flood.
which name?
Humberto,
from DEP.
Ah,
DEP.
yes,
to
yes.
address the air quality
should.
and the flooding in our.
And it's about time for him to come back also,
Yes.
because he was
We haven't
at
seen him in a
our,
while.
and honestly, we haven't he's been involved, I think, with the bus stop that,
The noise.
and we haven't,
Yes, yes.
we really hadn't invited him again, so that's a good ask.
And
Okay,
are you, I can invite him on, if you know, if you want, or you will.
Yeah, you can.
he's come to the health committee, and he's worked with us on a resolution, so it'd be
Oh,
great.
good.
Can you
Okay.
invite him on behalf, and we can, or we could have a
No,
joint
you will-
meeting?
Yeah, just whenever it's convenient for the agenda, but we need to see him
Yes.
for the agenda.
Absolutely, absolutely, I have that down, and I think Edwin kind of reached out to him last time, but it doesn't matter. I can reach out to him also.
Okay, thanks.
Great suggestion. Humberto Garza is with the Department of Environmental Protection. Okay, so he's going to come back. A new community partner for us, Dr. Gianna Reinstrom, who is founder and president of the COTA Alliance. Thank you for being here even early and helping us out, answering the door and all of that.
Yes, thank you.
And you've been wonderful. So let's hear about the COTA Alliance and your Women's Health Forum.
Thank you so much for having me. I do have some slides. I wonder if I could share them. I'm on Zoom actually now, but I can
Let
keep
me,
my sound on
and
so that
make-
it doesn't
We'll
echo.
make
you
you
a
a co-host.
There you go.
Okay,
You'll be able to share it.
okay, let's see. So now I should be able to share my screen.
You might, the
let me
sound
just
is
do-
not too, are you guys on Zoom hearing us pretty well?
Can you hear me
Yeah.
over there?
Yeah. that's
Hearing-
Well, they're
hearing-
all.
Hearing you physically in the room?
Yes.
Yeah,
We can hear you well.
Okay.
okay, good. All right, let me just do this. Screen. Okay. So, yeah, so hi everyone, thank you so much for having me. My name is Jana Renström, I'm originally from Finland, but I have been here for over 40 years now. And by training, I'm an OBGYN. I trained at St. Luke's Roosevelt Hospital, which I guess doesn't exist anymore as such.
Yeah, your Mount Sinai West.
Yeah.
Yes, I'm gonna take it over.
Yeah, and I've also been sort of on the sidelines of human rights activist all my life, so, when I retired in 2015, I've been working on this project for a while already, but, so we established the COTA Alliance as, an organization for gender equality and women's empowerment. And we are both a local and global organization, and, all over the world, we think that, you know, and I'm sure you agree, that for society to get better, you know, women need to be empowered. And there needs to be gender equality, so that's like a given, right? I'm actually here with a couple of my team members are on Zoom as well, Annie Reynoso and Maureen Hogan, so they're.
Yes, they presented before.
Yeah,
Yes.
so they're with COTA, and we have been working together on this health equity program. And Annie has a background in various public health projects and nonprofits, and Maureen also has been active in doing research for several nonprofits and is currently a student at City College. So our mission and vision, let's see, let me scroll up here. So, so initially we were just, as a new nonprofit, we were housed at something called the Center for Social Innovation, which doesn't exist anymore. They went under in the pandemic. They were in Chelsea, but we had been looking to move up to Northern Manhattan already for a while. And so last January 2022, our building had 43 St. Nicholas beds and 157 students. And it's our headquarters, basically. It's a hub for basically for other nonprofits that are mission aligned. So we're more of an umbrella organization. We don't want to replicate or reinvent the wheel or compete with other existing organizations, but rather build up a coalition of organizations working towards the same goals for empowerment of women and girls locally and globally. And so we started last year with basically one of the two pillars that we consider essential for women's empowerment is economic empowerment and health and wellness. So we started with economic empowerment through some digital literacy, financial literacy courses, and women entrepreneurship. And this year we're adding on the health aspect. We did have some yoga classes in collaboration with Harlem Wellness Center last year. And now we have a new organization actually in-house called Reciprocity Foundation, which have, they do holistic health. And we're looking to add more as we go along. And what we did, so on September 18th, we had a women's health forum. So we invited all the sort of similar organizations that we could find, both public and private, to join us for kind of a listening session and joint exploration of the most important issues in this community. And so the purpose was to basically just everybody to introduce themselves and get to know each other, and then for us to find out what they thought were sort of the most serious challenges and where there are gaps in services, and to see if we could collaborate, going forward to eliminate those gaps. And this was only one of several such sessions that we plan to have. In this first one, we actually wanted to focus on an issue which has been in the news rather a lot lately, and that is increased maternal mortality, especially among Black and brown women, right? So we had actually one way to tackle that is we're exploring doula programs. So I don't know if you know what doula programs are.
Yes,
Yeah, you know that, yeah. So, we can skip this slide because that's just a lot of statistics, but obviously you all know that many health indicators are worse up in this area than sort of New York City overall. And this is the facts about the maternal mortality rate, which is so much higher for Black and brown women than for others. Hispanic women are sort of in the middle, and white women lowest. Although the absolute numbers are not huge, I mean, this is still a relatively rare phenomenon, but it's concerning. Something happened here.
It's increasing, isn't it?
There we go. And
That was 2020.
yeah,
That was
here we go.
2020.
It's funny, it's slower on the screen. So anyway, here's some stats about pregnancy, pregnancy and birth and maternal mental health. So that's another aspect. And so what we want to address, what we're trying to do is basically research and see if there's a base for us to help do something about this issue. So we are doing research on the effects of the doula care on maternal health. There are even some, more recent numbers than this now. In fact, there's a new publication called the New York City, can't remember the exact name now, but it's published by the City Doula Initiative about the effects of doula care in New York City. And that indicates that there's still a great demand, and there is more demand that can be met. So we are looking into providing training for doulas and So what we're gonna have, at some point in the next few months is, a listening session on more on this particular issue. And then we have other issues that are gonna take place also at other, health forums. For instance, already on November 16th, we're gonna have, together with Reciprocity Foundation, we're gonna have a, listening session, for LGBTQ, organizations, to come together. We also have, I am actually part of a mayor's committee on addressing female genital mutilation in New York City. And so we want to invite some, certain communities where this may be prevalent. To come
I'm
in for
curious,
this
is that
session.
prevalent among those countries that practice it
Yes.
and have come here and still practice it? Oh my
Yeah,
God.
this is the issue, and it's, we can talk more about that because, we would love to. It's a kind of a silent problem, we don't really talk about it, but it exists. Yeah.
As a trustee, and also from the avenue to research those West African.
Yes. Yeah, there are certain immigrant populations where this is prevalent, in their home countries. And there's a phenomenon called vacation cutting, where the kids get sent off for the summer to grandma, and they come back cut, and that's actually. So, yeah, I'm not gonna talk so much more about the doula program, because this is still in the research process, but, this is something that we're looking into now. And none of this will happen unless we have funding, so this is the next problem. Yeah. But, we would love to hear from the community, like, what are the concerns, where are the service gaps? And where is the opportunity for impactful collaboration among organizations that do this? So that's what I would like to say now. And only to add that, of course, we also like to use our building for arts projects. So art is good for everybody's mental health. And right now in October, we have an exhibit there called The Face of Justice. The opening is on Thursday. You're all welcome. From 6 to 8.
What location?
At 43 St. Nicholas Place.
43 St. Nicholas.
Yeah.
Place.
Space, yes, not at the place. We're green lighter. And our banner is outside. So you can get
What cost, approximately what cost? I think
152nd.
152nd.
Yeah, and if you go to our website, there's a link. We prefer if you sign up so we can kind of see a little bit who's coming and there's an optional donation if anyone wants to support and be a patron of the arts or matron of the arts. And
Do you have
anybody can come.
Okay, I'll ask you about space. You have open space that accommodates for what size?
We have, our public space is like 2 floors. So of about 1,000 square feet, so it's 4 rooms. We have an office space, then we have like a downstairs, a room which we call like a community room. It has a little patio in the back. And then we have on the second floor, we have a kitchen and a dining room and a kind of a living room. So we can accommodate a dinner for 30 people, or a conference or meeting for 30 people around tables, And
Each room?
yeah, we tend to use the 2 rooms on the second floor most. And then for smaller meetings, and we've had like film screenings on the first floor, for instance. So you should all come visit. If you can't come Thursday, come any other time. And even just to see the show now, it's open from 1 to 5, Wednesday through Sunday, most days. But better check our website because we have a couple of exceptions when it's closed. So.
Okay.
And you'll be attending the landmarks preservation meeting on Wednesday.
That's
Thank you
right,
for your
yes.
confirmation.
Yeah.
I haven't.
Yeah, we do have plans for renovation as well. Mind you, we don't have money for that yet.
Right,
So,
yes.
but we want to
Thank you
go through the
for
process, yeah.
confirming your attendance for Wednesday.
Yes, I am.
Okay, thank you.
Yeah, thank you.
And interestingly, the Arts and Culture Committee is meeting right now, 2 doors, where you.
Yeah, they've been really good about sending out, ads about this event.
And I'm sure we've seen it, the problem is on the community where we get so.
You get so much, yeah.
Yeah, but I'm glad you're doing that. But this, how many, can you reveal how many, women-focused organizations, were available for your September 18th forum?
We had, I think, 13 organizations.
That's good.
That's a good number. Yeah,
That's good.
and now I'm just trying to get everybody to answer the exit survey, because I've only 5 days so far, but that's a crucial problem.
Yeah. Were they all, in this, from this district or around?
They were mostly from around here. Oh. Yeah,
Okay, that's excellent.
yeah,
So we need to talk to everyone about our public health forum also.
yeah. So is that gonna happen at some point, or?
What I think we're doing now, I know as a matter of fact, what we're doing, Anita's working on some ads. I noticed you have this, with your presentation, you could pull out something that you mainly wanna focus on, and then we can drop that into a template and work with you on it and say that I think the slogan was community members care. Community members care. So it'll be sponsored by Community Board 9, but we're promoting our partners and we're educating and informing our community.
Yes.
So we'd like you to present something, so that we can highlight it.
Yeah.
And that will get started long before, we've been working on a location, and for some reason the forum, hasn't gotten back to us. And our partner, Columbia University Urban Medical Center, wants it to be at the forum first. The location is great, of course.
But why don't the public school, public health, wants to see?
Well, it's for the community, if you think of it, for all, you know, our grassroots community, probably better here. There's a City College has responded to us too. But actually, they said Dean Green is gonna contact us. He hasn't. I sent that email to Anthony and Jill, saying I haven't heard from him yet. I'll just look up his number, but I wanted him to make sure that that was clear, because they have a nice sized room at the medical center. But I was hoping we would use that for the environmental part. And then there's Broadway, the Sugar Hill Children's Museum, fabulous location, site, it would be great. It's big, yeah, it can hold probably 300 people easily in the general, attraction would be the research trials. That would be something different, because they have, researchers who come to our committee, and then they sponsor an event in June, and some of the research was on tobacco, alcohol, I think, on cancer, the latest research that they had, impacting our community. There was a third one as well that I can't recall right now, but they're doing other research, even a component of Alzheimer's. And I think it was Alzheimer's and autism together. So there's a lot that's going on. They have a teen program, from a mental health perspective, that's going well. And so there's a lot of research. That will be the centerpiece of our forum.
With that, I was gonna say that with that mental health that you bring up, just reminded me that some of the work that you do, you can find some synergy with some of the partners that we have.
Exactly.
Like Heritage Heights, now they have expanded their mental
That's
health.
right. It's called Heritage.
And Dr.
Heritage Behavioral.
And Dr. Milano is here, so some of the clients I might come across that, because it's very difficult to try to get an appointment for mental health, right?
Yeah.
There's some anxiety, and you don't have a crisis that brings you to the ER.
It's a good point,
So they were saying that now they have increased the capacity of mental health providers in their facilities. So she's here, ready, she posted her phone number in the
There's
chat.
Dr. Milano.
Yeah, she's nodding. She's nodding right there.
So I would say, get in touch with them, because, you talk about pregnancy and mortality. These are issues that come up in relationships, and, we all like to think that every pregnancy is desired, but that's not necessarily true. And that's where mental health can help deal with those situations and the trauma that happened postpartum.
Yeah,
because we only focus in the intrapartum.
that's right.
But postpartumly, there's also a lot of issue that takes place.
So
So
we have two groups, I'm not sure if Wendy is here with the Tau Omega Foundation, they have a behavioral science, and they have their
Yeah.
psychiatrists working with, college age students and, I think junior, senior high school,
So-
they're beginning to do
you
something
can
with.
find some synergy with the work that some of your groups are doing, some of what you're doing, with some of the partners that they're already doing, because indeed in the community, when you look at women of color, you know, Black women, they have worse maternal outcomes than in many third world countries. So you're better off catching a plane, going, you know, somewhere else than giving birth in this country.
Yeah.
And that is a shame. And health and equity are man-made. They're not, you know, born in nature. So, this is something that we can work together to decrease. You know, the big institution, they're doing their job, but sometimes the work that you have a passion for is not where, you know, they're moving towards. And we have seen that with the decrease of, maternal, birthing centers. Birthing centers that have disappeared because now the focus is you come in 48 hours, you're gone. And if you get birth, we have C-section, one or the other.
Hospitals don't like birth centers, but hospitals, they don't make that money.
Then you learn the, you know, the natural birthing process takes place. My wife was 42 hours in labor. Tell anybody that they go crazy, but she's like, look, it was completely fine.
Yeah.
You know, we had a midwife, we had a doula. It's a very different approach, but that's not everybody, right? I'm a provider myself, that's not the general population. So we want to make sure the general population has that advocacy in those avenues, so they can be receiving the healthcare that everybody else is getting.
Yeah.
Uh,
I just wanted to ask if Annie or Maureen had anything to add to this. Annie or Maureen, do you want to add anything?
you have to unmute.
No, I think I don't have anything to add at the moment. Thanks, Donna. Yeah, I think you covered it for now at least. Yeah.
Okay, thank you.
Dr.
And
Milano?
also, same here. I think that the presentation pretty much covered what some of the goals that we have in mind, and where, you know, we're hoping to kind of identify some areas, some gaps of service, so that we can really kind of create something that's sustainable here in Harlem.
So I would suggest that a good partner to speak with is Heritage High, because they have boots on the ground. They're very invested in helping the community. They see a lot of the patients here. So, coming to us is great.
Heritage.
Yeah.
Okay.
Dr. Milano's here, I know we keep quoting her back for this because they keep coming to us, they tell us about the services that they're giving to the community. So they hear from the folks that are coming into their center.
Right.
And we're fighting to make sure that that site on 145th continue to provide the same services that it's doing now, if not better, because that is undergoing a, we're in a battle to make sure that it stays, you know, in the community.
Beneficial.
Yeah, beneficial to the community, yeah.
Accessible and beneficial to the community. Dr. Milano, do you have anything to add in particular? I know it's the startup, but with the behavioral, Heritage Behavioral Center?
Yeah, that's the Heritage Behavioral Healthcare Center. Yes, so in any case, my name, email address, and telephone number, cell phone number is in the chat, so feel free to call me. And
Right.
if I don't pick up, please be patient, because
Okay.
we'll get there.
Um,
Get back to you, yeah. So in any case, there's a process to obviously, if someone's in crisis, that's a whole different story. But there's a process in order to have people register and be a patient of the health center. And we can arrange for psychotherapy pretty quickly. We have nurse practitioners who have space and can do the first. Yeah, so in any case, we can put together a team, certainly. And just call me.
Thank you.
Thank you.
Because we're in a different kind of setup that I'm getting used to, but Edwin has pulled up the chat. If by any chance you have a question or your hand is raised and it doesn't get acknowledged, it's because we're multitasking down here. Feel free to just speak up if you haven't gotten recognized right away. And we're just about at the end. I know everyone wants to. You want to talk about your resolution?
Yeah, we can bring the resolution on, Barry.
And we should be, it won't take us, we're not gonna be that much longer. I did want to, after Edwin completes, he and I talked about district needs statement. And I'd like to get some feedback from the committee as we think about our district healthcare needs that need to be put in the budget.
So for those who are here, we have Reso.
The Reso is the one you picked up.
And you picked up here. So those who are online, here. Yeah, that's the one.
It says resolution title promoting residential parking for.
So as some of you heard already, when we talked to the council member, we're looking at the residential parking. I think that, got the general message, but residential parking for us, we're looking at it from the environmental lens and the health lens. When we have more cars that don't belong in this community, that increases pollution. Folks who live in this community, then they have to circle around and spend more time looking for parking. That increases pollution also. This is not a foreign subject. This is something that many cities already do. That if you do not live in that area, you don't get a sticker that says that you can park. If you want to come into that community, then you're gonna have to find a parking lot to park, and that deters folks from coming in here and thus pushing them to take the public transportation, which we have heard the city, sort of talk over and over that they want to push folks to take public transportation, but a lot of times it feels like that burden is only on us, not on those who are coming from the outside. The whereas this goes, whereas Community Board 9 recognizes the multifaceted advantage of residential parking for our community and well-being. And whereas residential parking offers a myriad of benefits to both the environment and the health of our residents. A well-planned residential parking system contributes to reduce rapid traffic congestion, lower vehicular emissions, and subsequently improve air quality, which has a direct positive impact on respiratory health, particularly those vulnerable populations, so asthma and other issues. Efficient residential parking reduces the need for circling and search for parking spaces. Consequently, lowering the noise pollution level and providing a quieter and more peaceful environment for residents, thus enhancing mental health and well-being. Encouraging residents and non-residents to use public transportation through residential parking policies reduces the number of vehicles on the road, which leads to fewer accidents and safer communities for all. The availability of residential parking fosters a stronger neighborhood connection, as residents are more likely to stay engaged in community events and activities when parking is convenient, thereby providing social well-being. Residential parking policies that incorporate green spaces and tree lighting in the street that can contribute to improve aesthetics and reduce urban heat, not an isolated effect, and increase the physical activity to walk in and thereby possibly impacting resident physical health. An adequate residential parking option provides convenience for emergency responders, so ensuring prompt and accessible care for residents. So I don't know if you guys have seen it. Sometimes you have the ambulance, people are double parked, they leave their car, and the ambulance is stuck right there. Just waiting for that person to come out because they forgot to bring the car. So this sounds like we have seen it. Community Board 9 recognizes that residential parking is a must consider accessibility and affordability to ensure that all residents may benefit from these improvements. Now, therefore, it be resolved that Community Board 9 support the promotion, and implementation of residential parking, a solution that comprehensively enhance our environment and health of our residents. And that Community Board 9 encourages the exploration of sustainable transportation alternatives such as electrical vehicles, charging infrastructure, expanding the bike sharing program to further reduce environmental impact and improve residents' physical fitness, and resolve that Community Board 9 commits to working in collaboration with city agencies, local agencies, community board members to develop and implement residential parking policies that align with our goals and improve environmental quality and promoting physical health and mental health, fostering a community cohesion, and resolve that Community Board 9 will actively engage with residents and stakeholders to gather input and feedback on proposed residential parking changes and policies, ensuring that the community diverse needs and concerns are considered. Resolve that Community Board 9 will regularly review and assess the impact of residential parking policies on the environment, noise level, safety, social connection, aesthetics, and accessibility, making adjustment and improvement as necessary to maximize the benefit to our community. So this is a draft, and any amendments can be made now before we show it to our.
How does it
board.
sound to those, if you followed along?
It sounds good to me.
So can we take that down, see?
Yeah, sure, we
so
can do
our, I wanna see if Amir and Patricia and
Somebody has a comment?
who else?
I need to run.
Yes.
Yeah, Milano have to.
Amir and Patricia, what we're doing now is, you read along with Edwin. He always does a terrific job, being pretty thorough. Is there anything that anybody here sees that, we can always add later, but right now that should be, any comments? Heather?
Thank you. I guess my question is always, I don't know how involved up front we should be as a committee with stating certain policies or certain things that should, in terms of who has access and how it's determined, if there's a fee even for a residential parking permit, if the person has to have a car, or can they just be an owner, who occasionally may have the need for a car, may not have to own one all the time, for an example, which is a good thing. But, you know, for the casual or user or whatever, I'm just wondering how deep if we need to have any of that included. Although I'd like to.
Can you just speak up a little bit? I can't hear.
It does capture some of that in the second paragraph on the back of the page, but I'm just wondering upfront if we should try to improve the framework of some of our asks before it goes to city council or wherever it's going, or to DOT or whatever we have jurisdiction.
So you're right. Here we're not saying, you know, we're not getting into who owns a car and who doesn't. All we're saying is that to park in this community, you should be a resident of this community.
Yeah.
And that is not a foreign subject because other communities have done it. We are pointing out that the current system doesn't work for us because what you can see when we get out is that you see plates from Pennsylvania. I should have taken a picture of that Hawaii. I would like to know how they got it. And what that is doing is that the resident of this community, now they have to go around and look for parking and spend more time. I said this before, I was in Boston for a conference and I saw a nice parking spot in the street and I parked in the street. I was like, oh, great, you know, I don't have to pay for the hotel parking lot. When I came back the next morning, I had a ticket for I think it was $155. And then when I called them and I was like, guys, I'm in a conference, I'm at APHA, you know, what's going on? They're like, well, it's residential parking. You don't live here. I was like, I'm sorry, I didn't know, you know, what do? You pay the ticket. That's what they told me, because in Boston, where I was, only residents can park in the street. And that was the reason why I saw all that parking space empty, because you needed to be a resident of that community. What the status that we have at the moment is that anyone can park in our community. And that is creating the mess that we see now, where you see vehicles, you can see it with plates from all over the place. I'm not even gonna get into the insurance part of it, and that's another issue for our own residents. Because folks who have vehicles registered in other places or are here, when they have an accident here, that increases your premium and my premium.
Well, I'm just speaking about the casual user, or someone who may have a visitor from out of town.
Well,
Who happens
DC
to visit for
Right.
a day or two on
So-
the weekend.
So if,
DC does it differently. If you go to visit in DC and you have to park on the street, the resident has to take you to the local police station, and the local police station gives you a pass.
yeah,
You don't have to pay for the pass, but the resident actually has to physically take you.
yeah.
And you have to put that pass, it gives you, there's an expiration date,
Mm-hmm.
and you put it in your window. But the problem with that is cops don't want to be bothered with that, so I don't know how that's gonna work. But the reality is, they keep saying people should use public transportation. But just so that everyone knows, the bus on St. Nicholas does not run between 3 and 5 a.m. in the morning. So if you have to be at work at 4:30, you have to drive. There are people in this community that work way down in Delaware. There are people that work all the way up in Connecticut, by the Massachusetts border. This
Or they're
community
nurses that have to be at work at 4:30.
doesn't have people that necessarily work conventional jobs. They are not telecommuting.
Yeah.
So they have to get to where they have to get to, and it's not fair that people can't find somewhere to park that live in this
The
community.
people that live here.
Wow, rat bins are taking up spaces, and college students are taking up spaces, and commercial vehicles are taking up spaces.
And the people who live here, who pay
Right.
taxes
And
here.
police
Who
cars
have their
are taking up
vehicle.
spaces.
Well, I understand police cars because we have the transit
Yeah.
bureau at 145th, and they're in the middle of a call, they can't come back and move their car for alternate side of the street parking, and Department of Sanitation is supposed to send someone once a week to clean those streets so that there is no garbage. If that's not happening, then that's another issue, but I understand about the cops, because, but I don't recall, you can't say I got to leave here and go and put my car, I mean, that's just the reality. But the Department of Sanitation is supposed to do their job. That was one of the agreements, so that cops could park on St. Nicholas. And if they're not doing their job, then we need to call them on that. That's all.
No, but the transit police, they do have a designated parking area. You know, they take up quite a few spaces. I'm not complaining about that. I'm not saying that they shouldn't have that area, but I'm talking about the other side streets.
So this is more just residential parking. You live here, you have a vehicle that is registered to this address, registration, you pay your insurance here, you pay your taxes here. You should be able to park a vehicle in this community.
But
When
then,
you,
Edwin, but then the caveat that Heather mentioned in terms of
I want
being
a rental car every now and
an owner, cause I don't have a
That
car,
pays taxes.
but I have family to come,
They come
and they need to be able to park, and they come from New Jersey.
so if you go right
You're
now,
comfortable
if you go to New Jersey, to Weehawken, right now,
Yeah,
and you go with your vehicle, bad enough, you either find a parking space or they'll give you a ticket. You cannot park in the street.
I'm saying we have to have some flexibility in
Right.
our
The
community,
question,
because
is this
we're
an
not a
issue?
community that has a lot of means and that, or have family that has a lot of means that can pay $100 a night for parking.
My question is this an issue that this community board by itself can decide, or is this not like a larger city issue, which actually affects the entire city? And
We
you
make a
the city
We make a
council?
recommendation.
Yeah, but we don't have to come up with all the answers.
No.
It's complicated, we
Indeed,
just
yeah.
raise the issue.
Yeah.
And then let them work it out.
Yeah.
Exceptions. et cetera.
Absolutely, yeah,
Yeah,
and it has
But our
been,
input is important,
absolutely.
especially as it relates to our community boards. We're one of the few community boards who can double park during off-street park. Some community boards, you can't do that.
Yeah.
But look, my colleague lives up in Country
Westchester,
Club,
yeah.
there is no alternate side of street
Mhm.
parking.
Yeah.
And there's no alternate side of street parking in Pelham either, and there's none in Thrive's Neck.
How do they clean their streets?
Yeah,
It's very clean, it gets clean, there is no, well, and let me just say this, alternate side of street parking in our community is a joke. I was off for a month, and I sat on 142nd Street in my chair between 11:30 and 1:30, waiting to see how many times they came through
One time,
for a whole month.
yeah.
And that's 4 days. So that idea that they're cleaning streets, they're not cleaning streets.
And we had a litmus test during COVID, that they were not running, and it's not that the street they got dirtier. So during COVID, vehicles were not moving anywhere,
Right, and there was no difference.
and there was no difference.
There was no
So-
difference.
But, this is an issue, somebody wrote in the chat that the NYPD, they don't want the NYPD to enforce it, yada, yada, yada. In some communities, what they have is that the vehicles that are registered to that community, when you see the camera that they have in the back of the vehicles? The cop car can just drive by, they don't even have to get out the car. That, reader can detect if you belong in that community or not, and it will send you the ticket home. We have a crisis where folks, when your family comes here, they're looking for parking all over the place and going around, but the people who live here, we hear a story of people sleeping in their car.
Yeah, to keep it, so they don't get a ticket.
To be people who live in this community. So I feel for folks coming from outside, but we have to feel more for those who are living in this community. So, Amir, you have your hand up.
Yes, thank you, Edwin. I appreciate this discussion, and it's I think an interesting, lively one. I think I would just like to share for the record that I have concerns. I think about this resolution and the principle behind the proposal. For example, I find some of these examples to be anecdotal when I think our committee can be focused on systemic and structural approaches to the environmental impacts of traffic and congestion and automobiles. For example, like this example of people sleeping in their car to keep a space. I mean, I find that, an unfortunate anecdotal example, but I do think that a proposal like residential parking is needlessly punitive on, there have been examples brought up about family members who commute and visit. Also, there are people who contribute to our community and to New York at large. New York City, this is not a surprise to anyone who has lived in New York, has a long-standing tradition in the tri-state corridor. People commute here. And of course, I don't want to defend cars. I don't own a car. I love public transit. I'm married to an urban designer. I really love public transit. And I think, for example, why isn't, if we are actually concerned about the emissions of cars and the health impacts that traffic generate in our community, why aren't we up in arms about the MTA rate hike? Why aren't we passing a resolution demanding that the city work with the state government to reverse that rate hike and encourage public transportation? We should have greater investment in public transportation and greater investment. But I just think also the final thing I'd like to raise is, the enforcement of anything is struck with racial bias in this country. It doesn't matter what it is. And I cannot conceive of a policy like this being implemented and it being equitably enforced. It will end up being disproportionately enforced on, I think, Black and brown commuters who come to New York and contribute to New York. So I just don't know if, I know that there's excitement and interest in this proposal, but I probably would be, I don't think I'm in support of it.
I just want to make one other comment in terms of people sleeping in their cars. I know of people who are sleeping in their cars because they are homeless or unhoused. So, I just want to make that point. So they don't have an address, even though they've lived in this community for 20+ years. Currently, they're unhoused, they're comfortable with the community, and that's why they're sleeping in their cars.
So I will refer back to the title of the reso, that is in an effort to improve the air quality of the community. If we have, and the health of the resident, when you have residential parking, that indeed has an impact on vehicles who are not registered in this community. A lot of the other stuff that is mentioned is anecdotal. However, it is no secret that more vehicle, less parking, folks going around increases pollution. And that is the purview from where this resolution is coming from, that having residential parking will have an impact not only on the environment, but also on the health of folks. And it's no secret that MCB9, we have the worst asthma rate than others. And this is coming from a place where other places it has been done. And it's not new, the implementation. A lot of the, questions or concerns that Amir brought up, this is something that has been, implemented for decades.
Do we have examples of city, or list some names of cities or neighborhoods where that's happening?
New Jersey.
Can we attach?
If you go to New Jersey, you try to cross the George Washington Bridge. During peak hours, certain communities in New Jersey will not let you drive your car to their community during peak hours. It has a big sign. If you're not a resident and you pass your vehicle through here, you'll have a cop giving you a ticket. Because they're trying to decrease the pollution.
Can you, or direct us to where we can attach, like you did the addendums before? I think it would be probably good to provide some additional
The status quo,
examples
the status
or
quo,
data.
yeah, the status quo for us, we see what we got. Folks are complaining about parking, people that live here, the bids are not going anywhere, they're gonna stay. You know why they're gonna stay?
I don't know.
People are happy to foresee less rats. So people.
I've been on them streets, that's not true that you see less rats. I walked up 147th Street, there was been, and there was rats just running.
Yeah.
So, I mean,
They just started that for no reason.
Yeah.
yes, there's no reason. First, they said it was like Rome. Okay, I've been to Rome, I've been to Florence, and I've been to Sorrento and Capri. There ain't no bins sitting on the middle of the street. So then they went to Barcelona,
Spain, they
Spain.
have, yeah. In Spain.
Right, and they hide those bins. They're not sitting in the front of somebody's brownstone.
Yeah, so they're gonna do something, and Spain goes even further when it comes to environmental and vehicles. In Spain, there's a certain section, if you do not have a zero emission vehicle, you cannot drive your car.
Well, I'm with you on that.
So we're not, with this resolution, we're not going and saying, look, you need to have a zero emission vehicle to park here. What we're saying is, if you're not a resident, the vehicle is not registered here, then the street parking should be reserved for residents.
No, that's how, right, and that's the issue that people have.
And
that is the issue that people have.
And that is going to, those who live in Westchester, instead of driving their vehicle, they'll take the train. Because they're gonna say, you know what?
No, that's the issue, it's people that live in the vicinity that are parking on our streets to get on the subway to go downtown. That's the issue.
So that's why you need street parking, residential parking.
But now what Patricia wrote, thing about congestion pricing and
Yes,
that.
that is gonna increase even further.
Oh, yeah.
And they're
That
gonna
is-
do
that's gonna
congestion
increase even
parking, so
further.
we as well try to get ahead
Congestion
of.
pricing is already done. We're not gonna do anything about
Listen,
that.
no, there's still a lawsuit, there's still hope. But the reality is, there was no study done for the impact of congestion pricing on people that live up here. There was no study done. And nobody in the city, I've listened to those things, and they do not answer the question, okay, so what's the impact gonna be on people who live in Upper Manhattan? A yada, 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 yada. You're right. Because it is gonna be an impact. You're right.
But
And
so
that's why
the
we
thing is
gotta
that
get ahead of this
we
stuff
have
sometimes
folks that are
instead of
coming,
just letting it happen.
folks who are coming from New Jersey, Connecticut, Pennsylvania, and our part,
Westchester.
each one of, when you get out, look at the plate number. Look where the plates for these vehicles, where they are. So these vehicles are coming and they're taking the space, not only the space, forget about the space, they're polluting our air. Because if those cars were not here, they will be left somewhere else. So, you know, shall we take a vote?
And that doesn't mean, other issues cannot be,
Or
maybe a resolution or have this modified. Or do you wanna see it modify some more and make, some suggestions?
I think we should work on this. In concept, we need to do something and get ahead of something, but we need to start formulating a framework around some of our issues that directly affect our community.
But this does directly, that's what I'm saying, this does directly affect.
Some of the
The
categories.
others, they can still be addressed. The one that, you know, Amir brought up about the MTA, you can still write a resolution about that. Put the rest of four, bring it up to the community. We have, you know, this is an issue that, is here. I mean,
And it's getting ready to explode.
Right, I agree,
Yeah.
I agree. Though, once again, I'm gonna go back to something that Heather said. I have no issue with us living here. I think we should be given priority. But maybe there could be a tweak that if you live here, or if you have a family member that's coming to visit you that lives here, that's my thing, because.
Well,
And then- Excuse me? It won't, but that forces people who live here and are conscious to take that extra step.
But that's not true, cause let me tell you what they gonna do. Well, Pookie's cousin is gonna ask for a parking permit. And when Pookie, cause Pookie's gonna sign whatever paper he needs to sign, and Pookie's cousin can live in Pennsylvania, but let's say, you know, he commutes from the Poconos every day. Okay, so he's still gonna have that parking permit. Okay, let's say,
Maybe it could be done for a little, maybe what we should think about is.
okay, and then they do it 2
designated
days at a time, that's the problem. And I can see making Sundays, a time where people can park, cause they're talking about doing that downtown. You know why they're talking about doing that downtown?
It's
The
already like that.
the
It's already like that.
It's already
groups have told them that X amount of our clients come from out of town in the local area. So I mean, there's all kinds of ways to do it. I have no problems with making Sunday park free, but Monday through Friday.
Right, that's what I'm saying, some
you know,
flexibility.
good point that you bring up,
I like.
Monica. To Amir's point and to some of the others. in the
Yeah.
group, it's not a foreign subject even in New York City.
Yeah.
Go to downtown Brooklyn and you will see in downtown Brooklyn, if you are not a resident, you will be ticketed.
And they
Because I have
also
been
do
in
not
downtown
have
Brooklyn.
off-street
Yes.
parking.
best practice? Can we look at?
So if you go to downtown Brooklyn.
That's what I'm asking,
So-
let's say, you
so-
have some examples.
So this is something like it was said before, it's a reso. to send you know, from the community board, it's gonna go to the executive, then to the general board, and then it will go to the city council. It still needs a lot of work. However, the problem still exists that residential parking is something that must be addressed. Somebody wrote that Brooklyn is gentrified and everything. Yes, it is. However, you go to Brooklyn right now, and if you're not a resident, you cannot park there.
In some parts.
In some parts, yeah, in some part of downtown. What is that doing? You look at their street, there's always parking and there's less vehicle. The parking situation, fine, but what we
Right,
are.
but those people in but here, you gotta look at this one, Edwin. The people in downtown Brooklyn do not use their vehicles the way that black and brown people in this community use them. We use our vehicles to get us everywhere with everything and everybody. So I'm just being honest, so you gotta look at it, like the people in this community that work far away.
Yeah.
You know, this is how they make their living, because public transportation will not get them to where they gotta go.
Because when they come back
What
at
about-
5 p.m., they don't find parking. They
What
have to
about-
waste 2 hours going around, creating more pollution for
No,
everybody.
I agree.
What
So-
about doing a survey to see what is the time when between how many people will really use public transportation between 3 AM and 5
There's a lot, there's a lot of people in
Yeah, a
this
lot,
community
but
don't work.
If we have
Conventional
evidence
hours.
on how much people use it, we can start an agreement with the.
But this is.
Right, but we
if
can't
you-
study
if-
it because
yeah,
they don't
if
run
you-
the
if you-
buses.
If you live here,
Right,
you,
I
you
mean,
know,
let's
your
be
vehicle
honest.
is registered here, you're paying your taxes here. This is, you know, an issue of you having residential, like, if you live in this community, you should be able to park here.
I agree.
You know, that is just the premise, and this is looking at the impact that is having on the community. Which is indeed, you know, we talked to, you know, Humberto about air quality, we have one of the worst air quality in the city. It was already done in the community health assessment. When you look at, you know, the major issue that is affecting MCB9, so yeah.
Can it be a start that can be voted on with caveats, adding the considerations that have, or taking a look at the considerations that have been brought before us? I mean, I know you did a lot of work on it, it's always gonna be something, but it can be, you know, tweaked, and by the time it gets to executive, there's gonna be a lot of questions there too. And then they have to go back to the drawing board again, but at least before it gets to executive, at least you get encouragement to go forward, or we as a committee get some encouragement to go forward, but take into account homeless, living in the cars. But I think there could probably be something where they may, just based on what Heather said, there should be a way that there can be a registration plate where they are, it's right there on their car, as long as they're not disturbing the piece of that's, we have to look at it, you know,
We are not the exception.
and bring
Yeah,
up
that's the
certain
thing.
things with the exceptions.
We are the exception when it comes to non-residential parking.
Yes.
in the city. Every other
But their
city has-
residents say.
I don't understand, you know, we can dissect this the many ways you wanna slice it. New Jersey goes as strict as saying you cannot drive down Broadway between X hour and X hour because you're supposed to take the highway. They don't, you know, they already have residential parking. They took it the next step and said, you know, if you don't live here, you shouldn't be driving during this hour. So the residential parking will have an impact on the environment of this community.
Or cities or locations, best practices to be added.
Yes, just maybe drastic measure.
I think overall, the premise is good. Period. And you're right, maybe we can't get to everything, but I think some of the few things that we mentioned aren't, I don't think are unreasonable, because that is taken into consideration the people who live here. What the predominant passion being that we want to support our residents. So with that said, I totally get it.
And our
And when,
cultural institutions, our churches, most
As
people
well.
that come to church in this community
They
do
can
not
take the
live in
train
this
or the
community.
bus.
And they come to
Many of
church
them don't.
on
Many of them
Saturdays
don't.
and
They
Sundays.
use double parking most of the time as well.
They double park, I have no problem with people double parking on Sunday.
on the
because guess-
weekends, right?
Because guess what? DC stopped double parking and they have killed the black churches in DC because the majority of the people that go to the black churches in DC are not from DC, they're
Yes,
from
it's the same
Maryland
in
and Virginia.
Harlem.
Right, and it's the same thing, so I have no problem with Sunday, say, you know,
And
people-
Saturdays.
And Saturdays.
But, you know, the Monday through Friday thing, I mean, it's ridiculous.
Right, and maybe that's a consideration, Edwin.
And
Dates
are
to
there
get
enough
behind.
parking garages here for the?
There, and there aren't enough parking garages.
Right.
There aren't enough.
There's
Are
a,
there not?
there's
And
a.
that's one of the things we brought up with seventeen
So maybe this
twenty-seven
would
about
encourage building
adding
more parking
parking.
garages.
There's a
Oh.
hand up.
Oh, there's a hand up, is that, oh,
Yeah,
Amir,
I- Yes, no, I actually think these are really important and significant points that people in the room are raising about how the potential destruction of Black cultural institutions and religious institutions in Harlem by implementing this. But I also just think before we consider voting on a proposal like this, I just have some unresolved questions about how enforcement works, you know, because just as an example, at the very beginning of the pandemic, there were social distancing summons, right? You were supposed to be social distancing, and something like 90% of social distancing summons went to Black New Yorkers. And as recently as a couple weeks ago, there was reporting about how quality of life summons for things like public urination, park violations, open container violations are on a dramatic increase in New York City right now. And 90% of those quality of life summons to go to court are going to Black New Yorkers. So, I mean, whether you live in this community or not, I'm really concerned about how this is going to be enforced and how our Black neighbors who, I don't care if you live in New Jersey, I don't care if you live in Connecticut, I don't want anyone being funneled into the criminal legal system because they parked here when our entire culture and system prioritizes the car. That's why I think we should be focusing on the structural and systemic barriers to public transportation. We should be investing more in public transportation. And I think that would be a better focus for this kind of discussion.
I'm a defense attorney, I'm a criminal defense attorney by trade. I deal with this every day. That is Eric Adams letting the cops loose in our neighborhoods. He's the Black Giuliani, be clear about it. They have been given a directive to give summons. If you don't have your ID, they will arrest you. That's the directive that he's been given, and he's been given a pass. This would simply mean that the parking people go up and down. If you do not have the pass, the permit, whatever it is, you will get a ticket. It's just that simple. I don't feel sorry for people who live in Inglewood, New Jersey and decide to park here because they don't want to pay the $60 or $70, whatever it's gonna cost them to go to their office in Midtown. That will not affect our community and nobody's gonna be arrested for it. You're mixing apples and oranges. That's NYPD being told to arrest and harass as many people as they possibly can, and no politicians are saying a word about it. I'm talking about people who should be parking. Those are two separate things.
And quick question, Amir, so the proposal is to push those residents here to be more cartless and to not have a deterrent system for those who don't live in the community.
Sorry, I don't understand. Is there a question?
Yes, that's the question. So is the proposal, because what I hear is that, let's improve, we're saying, look, we want them to take the public transportation, but I think that from the way the way that we're viewing it is that we want those who are outside, we want to push them to use the public transit more
Right.
and not come with their vehicle to our community. But from what I hear is that, you know, let's do the opposite. Those who live here use less vehicle and use more public transportation.
I just have concerns about, you know, the idea of residential parking, especially with the examples that you're raising, Edwin, from cities like Boston, necessarily requires some kind of enforcement mechanism. And we're already seeing a dramatic increase in summons going to marginalized New Yorkers. This is not actually an apples and oranges situation. I work at a national legal and policy organization. I fight against criminalization every day of my life. And I just am concerned about the implications and how enforcement of this works. I also just the underlying premise that this is motivated by concerns around congestion and traffic, I find a little bit unconvincing, especially because, you know, what if people are driving in from out of state with electric vehicles that don't create the same kinds of emissions that locals, residents in our community might be driving gas guzzling cars? I just, it doesn't really make a whole lot of sense to me. I don't want to hold up the discussion anymore. I'm not in support of it, but I don't want to hold up the discussion by being the only person who's opposed to it.
Elizabeth?
Yeah, I continue to represent the resolution. As a single woman who owns a car, who's come home at night and has felt afraid to keep circling and circling, I now shell out a fair amount of money each month for a garage, just for my own personal safety. And, you know, I have seen where people, especially in the summer, come from New Jersey or wherever, park to go down to the Yankee Stadium or go to wherever. And I'm circling and circling if I go out at night. So right now I'm paying almost $500 a month for my safety for a garage. So I can see it.
Yeah, and you're paying for your insurance here, you're paying for your
Exactly,
transportation.
but I don't feel safe circling around for 2-3 hours alone.
So, all right, I
Well-
think that we always can have a disagreement, and that's just what happens in a democracy. So shall we
Right.
move for a vote?
So let's vote. How are we couching the vote? That this is
I didn't hear any amendments to it.
there were a number.
We did.
Yeah. We have to acknowledge that there were a number of things, people couched it in the form of, it could be tweaked to do this, tweaked to do that.
Okay,
So, how would you do the motion? Someone, I'm not sure how we would do the motion. Because I think what it is, we know it's an issue, we know there's already, some stuff is already happening in the city, and we wanna try to get ahead of it. But we want it to be in such a way that, it satisfies, as Amir was saying, like, and even Monica, how we use our
From the
cars.
enforcement aspect, the way Amir is framing it is that you're gonna have a cop interacting with somebody. That's not what's happening, with the technology that exists today. Her vehicle will be registered to X community,
Yeah,
and that camera will take a picture, not take you, but if your vehicle is not registered here, you're gonna take it in the mail, just like it happens when you go to the toll booth.
Yeah, New York, they're not there on the technology.
So,
No, I don't own a vehicle, but I'd like to drive every now and then, and I'd like to be able to park in front of my house every now and then.
Oh,
look,
but
you're
there's-
lucky that you have, if you're driving a SIP car, you have,
I'm
preferential
not
parking.
driving a zip car. I'm
No,
not-
those who drive
no.
SIP car, they have a preferential
No,
parking.
but I'm not
the
talking about
example
driving a zip
was,
car.
Heather, as I heard it, as long, whenever you do have a car, even if it's temporary, you go to the police station or whichever authority is gonna be handling this and register it for that period of time, or if it's going to be permanent. But whatever it is, like say from September 30th to November 30th, I live in the community, but I will have a car here for what, for my personal purposes. So you get the plate, or not plate, but a placard that's in the window. So that's how that could happen, cause I have a car, it's got Ohio license plates, but I have a residence right here in New
Yeah,
York.
then
So I'm
Ohio
thinking
is
about,
cheaper.
I would register that, but
I think
because the
cars should have to be registered in New York City, and they should have to, pay the New York City.
Rates.
Absolutely. I do not think people with out-of-state tags who live in New York City should be allowed to do that. I'm sorry.
but,
I'm
but
sorry.
that's, I hear what,
Yes.
No, I was trying to understand, what did you say,
If you have a car, if you live here and you have a car,
Right.
that car should have to be registered to that address. You should have to pay New York State insurance,
Okay.
and your car should have to be registered.
Okay.
and I understand that, that's why when I brought my car up, I was overnight, and then my car went to the residence where there's a private parking. Yeah, so that part, I agree with it. So,
I mean-
but it can be accommodated, we have to just say that there are things to be tweaked to
Correct.
accommodate.
And that's what I want.
As Deanna said,
Some assessment,
time and space.
right, so I don't know if that means to hold it, to send in those concerns so that we can tweak them in a way that they can be, a part of.
That's what I think, can you, Edwin, do you think you
Uh,
can tweak it?
Can we
or-
hold it, Edwin, and
Yeah,
send
we
those
can- we can
suggestions?
Or can a couple of people work on it,
But
since
I
Edwin has
suggest-
already,
Yeah.
Elizabeth, you'd be willing to
Yeah.
work on this with
Yeah,
somebody on the phone?
Suggestion to offer for you.
Okay, so who can, Elizabeth and,
Oh, go ahead.
Two? Oh, that's right, you going out.
Yeah, I have one suggestion to offer, maybe.
Yeah. Okay,
It could, then,
Go ahead,
it could be residential, let me give them a chance to talk. It could be residential parking from 8 p.m. to 8 a.m.
I'm sorry, Coach.
but you're willing, can you
But
work
my
with?
suggestion, I have a suggestion to offer, maybe we could look at residential parking from 8 p.m. to 8 a.m. That would be when people are coming home, resting and whatnot, because theoretically, if you're visiting family, you're probably going home, whatever, but I'm saying that period of time when people are coming home and they wanna go to bed, get with their family, is when you most need the parking, because I've seen our neighbors circling late, they come in late and whatnot. And I'm thinking also safety, because it's just not safe to circle in.
But that messes up.
You know what I'm
people
saying?
who- That messes up people.
We're on the
who
same block.
say that have a car.
I'm sorry, what?
That messes
You know what I'm
up to
saying?
people
I'm
who have
working, I think
cars
it's a good idea.
every day, because you're gonna need somebody somewhere to park. When I get home, if I get home at 5, I still won't have anywhere to park.
Yeah.
So
So
you,
you'll be a resident, you'll be right, I see what you mean.
no, that needs to be none from Monday through Friday.
Yeah.
Just do it as a Monday through Friday,
Yeah,
tweak
I
and leave
think
Saturday and
people,
Sunday open.
right, and people,
Well, that's
that
a
means
start.
people can come to see their families, so, okay, let's say you wanna come and park in the neighborhood, it's not an issue. Sunday, you can deal with the double parking and the people coming to church, coming to
The status quo for those who live in this community is not working. We are breathing air that is more polluted. You can ask, one of our board members who has to pay $500 a month so she can have access to parking while she lives here. Monica's here, she can tell you how long it has taken her to find parking. So, it is no secret that a vehicle that is running extra is spewing more CO2. Those who live outside of here, they will be very upset, and we feel for you. But those who live here, they should have priority. Just like when any of us go to any other community outside of here, that we have no say in their business and how they implement it. But when we go there, we have to oblige by it. So the number one priority should be
Is
the
there
residents.
signage, let me ask you, in these other communities, is there signage that says, parking, residential parking or whatever.
Yeah,
Because if you come from out of town and you don't know, then you get.
It says parking permits needed.
Okay.
Yeah. It's all over the place.
Like I said, if we could tweak some of the stuff that we mentioned,
These are
I
some
would
of
be
the-
good.
That you have, you know.
I'm sorry,
Only, so, you know, they'll let you know.
We don't
I just
have
missed a
time
lot
for
of
that, y'all. I gotta tell you something. If we don't get this out, we will be, I'm just being honest with you. Adams has his own little plan.
Mm-hmm.
Please understand that people are paying him. He has incentives to do it. So we need to address this quickly.
No, I get you.
We cannot sit and wait.
I got you.
And we've tried to be, for the most part, we've been pretty timely on a lot of our resolutions that are getting attention in the city. So I agree. Maybe if we could, say, and it could even be changed from the committee that we agree to advance this with respective suggestions from the committee and present to the executive committee. If anyone sees, because we can mail it out, and if anyone sees something that they are just totally against, they can still, you can still say, I oppose this, you know.
Right.
It's opportunity to oppose.
But if we do have friendly amendments, do we wanna make a suggestion of when to send those in? So that perhaps then we can submit it to the executive committee, which would be meeting, is that next week?
Next Thursday,
Right.
Thursday is October, let's see.
Probably, I was gonna say that.
He would need time to adjust, that the executive committee meets on October 12th. So if we said, what works for you, Edwin, if you take it, because you've been typing all along, I know you got a bunch of other stuff too in school.
I'll leave it up to you.
But, you wanna say by October 9th?
That's Monday, yeah, Monday.
Monday, October 9th.
Next week.
Say, if, we can vote to proceed for positive action, progressive action with friendly amendments. And that doesn't mean, Amir, if you're, of course, if you're still against going forward, everybody votes their conscience on it. But, I would rather be part of, the solution, because I know, there's a lot of things our community has been behind on, but as a committee, we've been trying to be progressive. Proactive on. So I guess, can someone else word it since I'm co-chair?
Because the 9th is a holiday.
Oh my goodness, which holiday is it?
Columbus.
Oh, Indigenous
Peoples' Day.
Peoples' Day, okay.
So it's gonna be the following day.
Next Tuesday.
Well, we'll give him a chance to,
I think,
you wrote everything, so the 10th would be okay.
I'll leave it, I'll leave it. See if you have another-
Okay, we can email it to everybody. Okay, you wanna say Tuesday, October 10th? And then if you can't get it in on the 9th, okay, because everybody's not gonna be in the parade or whatever. But some people will be.
I wanted
So
to
let's,
say, who about Gail? Okay, I was trying to read it, trying to read the chat as well.
This is very important. It's a serious amendment, and I just wanna make sure.
yes, it's serious.
Yeah, I mean, it's overdue, because I know we've been having this
Yeah, we've been
conversation
having
about
this discussion.
parking, residential
And we just
parking.
gotta come to a decision.
And I understand that point.
And whatever happens, not gonna please everybody, but the enforcement is where we have to work with all our resolutions on enforcement.
Right.
So that's it's not new. Okay, so, someone else from, one of you guys really should, we're co-chairs, we shouldn't do the motion. You wanna?
Oh, So, motion to, I was gonna say, table the current resolution until friendly amendments have been submitted.
I second it. This is
Thank you.
Patricia, by the way.
Thank you, Patricia. Patricia, hola.
But that means we have to hear from everyone on October 10th as a vote, so it'd be a vote by text where it's in writing, you know.
You can vote on the reso. Any other amendments, they can submit it to the reso, and we're gonna have to bring it up to the executive anyways.
Yeah,
Or
the
we can,
executive
we can
October.
table it for the next one coming up. You know, I hear.
Let's just get
Well,
moving.
I
Let's
hear-
I
move
think
on
we
it.
should do it.
Let's
Yeah,
just move on it. Okay, so not table, because table is a delay, but, Lorna. I
Okay,
was
table is
thinking-
not the right word, but we're holding it because we're not doing anything with it yet until we make sure we hear back from people who want to weigh in.
How
I
about
just think
Heather?
this research, I think, Amir, he made some very good points. I can, me, I'm a researcher, I'm a numbers person, and I like to research some of the issues that have been raised before I commit.
You know,
Give you some time.
I mentioned in the chat, apparently, you know, this, I've just been looking into this, speaking of research. When Gail Brewer was Manhattan Borough president, apparently she led the creation of a white paper on 7 cities that have residential parking, and apparently the results were very inconclusive. The problem is the link on the city government website is a dead link. I'm trying to find a living document, but if I do, Laquita, I will share it with you so we can look at this. You know, 2019 wasn't that long ago, and here's a report looking into 7 cities, and let's look at the data and make sure we're being evidence driven about this.
Problem is, those cities don't have what we're gonna have to deal with.
We don't know, that's why they're saying research, use the comparison, but they lay it out. Just
None
compare.
of them have that. They don't have that in DC, they don't have that in Chicago. People in Chicago drive, they don't have that in Wisconsin, they don't have that in Minneapolis. They don't have that in Dallas or Houston. I'm thinking of the largest cities in this country. I'm sorry? They don't have that in Philadelphia, they don't have it in Charlotte, North Carolina. They don't have what, Monica? You know, they don't have this whole, right, yeah, you know, when you wanna go downtown, you have to, none of those cities have that.
I mean, but, like places like LA, they have residential.
I mean, I'm thinking LA, what about LA?
Right, but LA is a driving city.
Exactly.
They do not, and you do not have to pay a fee to go downtown.
Oh, you call it congestion price?
Yeah, they don't have that. We will be the only city in the
Really?
country that has that, yes.
28. So I'm just gonna put this up here real quick. Just real quick for context, since we want to look at data, this is the community health assessment from the Department of Health. This is basically the state of the union for the health, that the health department has. So let's go to page 28.
Yeah, we know there's a problem.
Page 28.
See, what I was thinking is acknowledging that there's a problem and that we start with this resolution draft, because he did say there's a draft. We start with this draft resolution to say, what I would say is, let's go forward with additional research and amendments.
Yeah.
That's the way I see it. That's what I think the motion should be. And then there has to be something ongoing, even, because I'm sure there's gonna be some things that come up in executive. And it's gonna be the same thing, but at least we're moving forward. We have something down. How do we tweak it to accommodate the research? Because this is very new, so it's not gonna be, even 2019 makes it new. It's not gonna be a whole lot.
But like I said, the problem is none of the other cities in this country have congestion pricing. And particularly in LA, I mean, most people are thinking today cars, if there was that, there would be a riot. So,
I mean, they saying on the expressway for 4 hours, just sitting, not moving. It really is a problem. But, and again, it can always be tweaked further. I just think we gotta act on something. And I'm sure it's gonna take a different form, but I think it's a good basic structure. And let's say the motion could be, we move forward with the concept of the draft resolution with, serious, inclusion and consideration of the friendly amendments and research, further research, documented research. That's how I think we should proceed.
Right,
So who's gonna
but
do research?
if you.
Heather, can you look into a few things, doesn't have to be everything, but look into a few concerns that you have, when you mentioned doing research?
Oh,
Okay, Elizabeth, it would be great to have your help, with some research, just going online, with whatever, even if it's talking to people, you don't have to, you're not redoing it, just give the pointers.
Oh, sorry, you went to the report and went to the section, you don't have to rehash it if the. I don't
Yeah,
have
I just
places,
posted,
right?
you know,
Alright,
the community health assessment that the Department of Health has done
okay.
for the community. We're gonna have Rebecca, we're gonna have Rebecca here next week. And I think that, you know, to have a true assessment of how many vehicles are parked here from outside, that data the city doesn't collect. But is a problem that we hear over and over again, many anecdotes from people coming in and telling us about their issues. We have one anecdote here, we heard many over here.
Right.
So, when we speak about data, is whatever you put in that you're gonna get out. That is very well known in research, right? So, when we're looking at this issue, the NYPD is not collecting the data of how many plates are from outside, nor is DOT. People do see it though here. So residential parking, I hear folks saying, well, we wanna encourage folks to take public transportation. Well, indeed, if that's what you want, then we should have residential parking. Because have anybody checked how much it costs to have a car insured in New York City? It is more expensive than having it insured in Pennsylvania or in Florida. So, look.
Can Amir, you be a part of this, like, the things that concern you, how it could possibly work? And then, you know, just do whatever research you can, and that doesn't, and then we could at least present to the executive committee, and I'm sure with all the research, it's gonna be tweaked some more, as it very well should be. And even if it's talked about, at least put in a position where we can talk about it at general board and get feedback again. And more than likely, they will want it to go back and be tweaked some more. But this puts us on the road to getting something done.
So what are we deciding to do now?
My suggestion, I didn't want to.
We said we're
not using the word table, I would say we vote to proceed with this draft resolution with friendly amendments and research by October 10th that get added in. Stop it there. Yeah.
Okay, so it's not the motion that we're.
Yeah, let me say.
Because you can't say it, someone else has to say it.
Yeah.
So.
We can go with it.
You wanna go with it? I mean, I'm sorry, it's a working, who wants a second? Dr.
Clotilde, second. Is there a vote? We have to still vote on it. All those in favor of that motion, say aye.
Aye.
Would you have to do roll call?
I think we have to do a roll call.
Roll call.
Because I think we have folks who are not in agreement.
Okay, so everybody understood the motion? Okay, let's see, Amir, how do you vote?
I vote against, unfortunately.
But you're gonna still do the research?
Yes, thank you,
So
Laquita.
here's a no, okay, Patricia? Where's Patricia?
Yes.
Okay, Monique?
Yes.
Elizabeth?
I support the motion.
Okay, yes. Heather?
Yeah, I support them to move forward.
Okay, let's see, Laquita, yes. Edwin?
Yes.
Okay, so there should be 1, 2, 3, 4, 5, 6, 7. Somebody did, but, oh, Clotilde.
Yes, I support them. Am I? No, I'm sorry, this is a committee.
Yeah, this is
I don't know what
so, Monica's public, I think the
Public
public
member,
member
right?
can vote.
Yeah,
Public
we
can
can
vote.
Oh.
Sometimes just for the record, you see.
I vote in favor, excuse me.
Okay, yeah, Monica. Cause I was in, there have been a couple times where, the public, just for the record, they, cause it's like getting community. Okay, so remember,
If my vote counts.
Yeah.
are you gonna be a public member? I'd love for you to be, okay, so I don't know what the process is. Okay, but Yana, yeah, in favor, yes.
And works well in Helsinki, but I don't.
Okay,
Yeah, no,
it works well,
Yeah.
it works well.
She said Helsinki,
They have a
Yeah,
So the
they have
research-
very good public transportation.
okay.
If you don't mind, can you, just bullets, you don't have to by October to just some bullets.
Yeah, we just.
So let me
we need
see,
to get the
Yana?
issues out there, so that.
Yeah, just see what else is out there, so we have a track record
Yes.
of the, what do we, you had, footnotes before, so we have data track record. So Yana's gonna present how it works in Finland, so we have the international perspective.
Right, all of your, it's amazing. Singapore has the best contract.
Monica, you gonna give us little bullets, please,
Yeah, I
by
will.
October 10th? Just email to me. Heather's gonna do some research, Elizabeth, research, Amir, research. Okay, so that's 5 people, cause I know I'll be working on a bunch of other stuff,
Yeah,
but by October 10th, and well, Heather, just do what you
And I'll be
can.
away, so, you
Okay,
know,
just do what you
I'll
can,
be away until.
okay. But be where we can get a text, cause then Edwin can add that in. And you don't have, if you have it right now, just, not when I say right now, before the 10th, email it to, the reason I say email it to me, so we have a central place, you know, to channel it. And it could be me and Edwin, cause even though Edwin's writing it, he's also co-chair, so you email it to both of us. Okay, and you can do it way before the 10th, while the thoughts are fresh. And he's gotten a lot of the ideas right now. And then, but it would be good to do this vote again on the 10th, to say with this, or we do online. We could do it online or not online, I could call. Okay. I think before we did the votes, I called, but we can also do it,
You could do a poll, you can create
do a poll, we can do a poll. And then actually Edwin can add in what he has thus far, he can still call it a draft.
Yeah, I don't wanna overcommit, cause I have to get some work done, and,
That's good.
Okay, so,
So
but you
whatever-
have done some,
yeah, so, you know, I mean, we can massage it and tweak it, I mean, the skeleton is there, so,
okay,
yeah.
Have something that's presentable to
Yeah.
the exec.
right, and we can still call it
You
a
know,
draft.
I think that, you know, the consensus is, the overwhelming consensus is that the status quo is not working. That is a consensus.
We gotta do
And
something.
whether we do something or not, we're all are breathing this air, whether we want to say that, look, where is the data, where's the data? The data about vehicles that are going in circle, spewing CO2, I don't have to bring that up to you. I mean, that is very well documented, right?
That's
Um,
not the issue, we're good at.
So the issue of having less vehicle in this community, go around, walk around, see what's going on. We wanna see less people with cars? Well, places that, like New York City is a very expensive place to own a vehicle that is registered to the address here. Many people who live here who are opposed to that is because many times their vehicle is registered in somewhere else. Whether it is Pennsylvania, whether it is Florida, whether it is somewhere else, New Jersey, because New York City is very expensive to have a car. So, to decrease the amount of cars, having something like this, it will indeed impact the amount of vehicles that we see around. from outsiders and also from insiders.
But I think it'll also bear fact of how many people park in Harlem and get on the A,
Yep.
the B, the
Yeah,
C.
we see that all every morning.
And go, of
Look
course
at the
we
A train
do,
every morning.
of course we
Yeah.
do.
Yeah.
They park right up on Amsterdam,
Yeah.
on Compton.
Yeah.
I mean, and fighting with City College kids.
The one train doesn't see it as much as the A train. 'Cause
No,
the
the
train-
A, that.
The
because
A
of
is because it's the
yes.
express.
Yeah,
And the
yeah,
D.
my street's ridiculous.
Yes,
Right at the
yes.
ABC.
So now, pay attention to the plates, the plate number, because I don't have the, you don't drive, so you don't pay attention.
Yeah,
Look
I
at the
can't
plate
afford-
numbers.
I can't afford a car.
Yeah, look at, yeah, exactly, so you don't have one here, right?
Yeah,
But look at the plate numbers
I hear you.
here, so, yeah.
All right,
Okay,
so we gotta wrap
Okay,
up, please.
so now here's, I didn't, I thought we'd be done sooner, but this was an important discussion. With the, I gotta do district needs statement, I was gonna get some ideas from you guys, but, I didn't take down when the district needs statement was due. It was
Is it
mentioned at the
November?
meeting.
No, October something, because they want us to do it earlier.
That's why we got started earlier. So
I
what we may
can't remember
have
the date.
to do,
October something. Earlier.
oh Lord, so I gotta, I'll work on that if the others can, and whatever is done, if everybody else is working on this
Do we
resolution.
have a comprehensive need assessment already?
What is this here that we
Oh,
have?
yes, okay, everybody has in
Right.
their possession,
Yes.
what's said, the top 3 pressing issues, and you'll see where it says healthcare services.
Right, came from last
You
year's
all have a
submission,
printout.
right?
Yes, well, it's supposedly enacted this year. It's enacted this year, because the fiscal year July 1, 2023 is June 30th, July 24th. So that's why it's called the FY 2024. So the one we'll be working on is 2025.
Right, but this is what was.
That's what's current,
Right.
yeah, that's current. And then you'll see everything from pages 12 through 18.
There's a lot.
And, yeah, we did, I
I
remember
think I
doing
remember
this.
this, yeah.
I think I did it with, we did the writing and Edwin,
But I remember perusing some of it.
and then it was done as a group.
Right.
You probably did it for the also the
I don't think I had a chance to do that, though, and I know we have more pressing things, but.
Yeah, but everything got tweaked even in-house.
Yeah, I think that,
So we need to look at, district needs.
Yeah.
And there's several agencies that we always, interact with. Health and hospitals, was it health and hospitals? DOH, MH.
Yeah.
There's something I don't see here dealing with the police department and mental health. There was a pilot program, and maybe I'm looking in the wrong place, they may have it under safety.
And Monica, because Monica can.
They may have it under safety, so look,
What?
that police pilot program with DOH psychiatrists. working
They're on the
mental
street,
health.
that on the
Well,
street.
I'll give you my experience. I called 911, but there was a lady in front of my building, had put lighter fluid all over her face.
Oh, jeez.
And she had a lighter. So my concern was that she was getting ready to light herself up. I called 911 and it took them 37 minutes to get back to me.
Oh, they're terrible.
And I Nick Smith is on Facebook and he reached out to me, he's like, show me. So I showed him where I called and how it took them. That is completely unacceptable. They called me 37 minutes after I called 911. And she had moved on, she was no longer in front of the building, but I mean, that could have gone.
911 is taking
You
it
didn't
over.
wanna take her lighter away from her?
I,
Or ask her, not take it, but
No,
ask
she was
her.
mentally ill, so I wasn't gonna do that.
yeah.
But I called and that's how long it took them to call me back,
We called 911
37 minutes.
the other day and it didn't even, it rang, nobody picked up. I was like,
Well, that's a problem, particularly with the people in the Bronx, because, you know, they're mad because you call 911 And either they don't come at all when you need them,
Wow.
or they come whenever, but yet you got cops stopping little black kids crossing the street. And you know, DAs, they don't seem to understand that. I was like, but you don't live in a community, because when they really do call about something, it
They
takes
never
them
show up.
forever.
Yes.
Yeah, it takes them forever to come.
Yeah.
And that's unacceptable too.
Right, so Nick filed a complaint, he filed a formal
So
complaint.
shall we adjourn the meeting?
I'm sorry, I have a quick question, and then we're done. You have these consent forms in here, did you want to
Oh,
address them?
yes, my goodness. Oh, Lord, we have so much. Public health forum,
Right,
we're doing the kiosk, as you all heard me say. And for those participating, we felt that there needed to be a consent form that their photos, even, it may be the back of their head, you know, especially if it's someone actually using the service. But we need them to say that they consented to the media promotion. So there are two forms, one is shorter, it came straight off the internet. And another one is longer, and I had given, I had to do one for my university, OSU. And so, but it's really long because, you know, they probably have more insurance liability stuff, you know.
But you don't have to do this because it's a public. The community board, it's a public.
Yeah.
You
Okay,
don't
so we
have to
don't
do
have
this.
to.
You do not. If
Okay.
we were OSU,
Uh-huh,
it would be different.
yeah.
Yeah, you don't have to do that.
Oh, what's that, oh, well, we have that on recording, because we are a public.
Public, people choose to come here.
Yeah, you don't need that.
Okay.
Oh, we don't need that.
Even if we use the face, say a teenager, his parent says it's okay, he's working through this, they're helping other teenagers.
Everything we do is public, everything is to be viewed by everyone, you don't need that.
Okay.
consent form? Okay.
All right, great, that resolves that then.
All right.
Okay, just hold on to it, just in case, you never know, but I like that
I mean, look,
information.
that could be a big sign that
So we
says this
call
is
them
a public
into,
meeting. All images may be used accordingly, so, you know, if you don't want your image used.
Well, it won't be of the meeting, it'll be like, say, Yana's organization working with,
No, it's
doulas.
public, it's public,
It's
it's
a public
public,
forum.
right, because we are the community
It's a public
forum.
forum.
Okay,
It's public.
and they're doing it for the community, okay.
Right.
So whenever you come to a public forum,
That's why-
you know that that's what you're coming for.
Okay.
Okay,
Nothing here is done in secret.
so we need Yana, you to present a program that you really want people to know about.
Mm-hmm.
And a enticing kind of image, we can talk about it again. And then I'll send you the template that we're working on, it's a draft.
Is it for the public forum?
Yes, and I have to, we've been having meetings on, Edward hasn't been.
Is that adjourned? We couldn't because.
So we should, can we adjourn and then wrap up?
Yes.
Chairs?
Yes.
So I make a motion that we adjourn the meeting at 9:31.
Yeah.
Second, who seconds that?
I second.
Thank you. All right, guys.
Okay, Amir, let us hear from you now, thank you, Patricia.
Yeah.
Bye.
Thank you for the robust discussion.
Yeah, Patricia, can we work on, like, say, minutes also by the 10th before executive? Because I find out now that they're asking for those really to be present in the packets at the executive. At least
Okay.
it's done for 3 weeks.
Sounds good. I'll send them over. All right. Good night. Get home safe. Bye.